Test, test, making sure the mics are working. This is a test.
I want to make this very quick. I don't care what your decision is anymore about all this stuff that's going on. But the only way that I'm going to buy, sell, or trade in this city, as I stopped on July 20th, when Walmart required masks. Since then, my wife and I have had to go to Volga, to Elkton, to Madison, and to Sioux Falls to buy our stuff. Now that's created a hardship on the way out of me ever buying again in Brookings is to fire that guy. Once he's fired, and eliminate every one of you guys on city council through election or whatever you want to do, that's the only way I'm going to return. I hope Ekerns sends you a $3,500 bill for the canceled contract with them. The $500 a month that I've spent over the years at Walmart, I hope they send you a $500 a month bill. I hope Lowell sends you a bill for around $10,200 for all the contracts I canceled with them, and an F-350 pickup for $83,000 from Inspire Ford. I hope they send you all the bills. But he needs to be fired. He's the most unpatriotic, un-American individual I've ever seen. His idea of inclusive is everything that's un-American. It's somebody that tells me that he's going to call the police because I want to throw out a sign that's unpatriotic in his office. That's just too much. And so as far as I'm concerned, he's going to be the casualty of all of this that's going on. And each one of you that voted yes, and even the phony votes of no, need to go. And when that happens, then I might return to Brookings and start buying things again. I'm done.
Kwaku will begin in 1 minute. Call a meeting to order. Please stand for the Pledge of Allegiance. Good evening. Welcome to the October 20th session of your Brookings City Council, which will be starting with a study session and then going into the regular meeting after that. Ask City Clerk to record council attendance.
Mayor and council members, as we are not all present in the same room tonight, please respond with present when I call your name. Bacon,
Present.
Brink,
Present.
Collins,
Present.
Corbett,
Present.
Niemeyer, Tiltonburn,
Present.
Wendell.
Present.
Okay, we have a quorum. Just entertain a motion to approve the agenda.
So moved. Second.
A motion, a second.
Second.
Council comments or questions? Yes. Oh. Got the study session. Idea is for the council to hear from others, so information to help drive their opinions, their thoughts. And so at the study session, we'll have several people speaking in a little while, and they're addressing the council, but you're certainly excited that if you want to hear their comments. So, but thank you, Patty. Okay, any other comments on the agenda? Seeing none, please call a roll.
Bacon,
Present.
Collins,
Present.
Corbett,
Present.
Niemeyer,
Present.
Tiltonburn,
Present.
Wendell.
Present.
Okay, the agenda is approved. This time open for council on a topic that's not on the agenda tonight. They had it down. That's why I was. Well, that's what I was thrown off on. All right, we're not going to have that. My question-
Actually, maybe Steve and Bonnie can clarify agenda.
I didn't catch that, Paul.
Okay, there's an open forum on the agenda, and I wondered about that, but be on a study session. We've never done it on a study session, but it was on
No,
the
I
agenda.
think we should commence the study session.
You should go ahead with it.
Correct.
Okay, thank you. Council, a topic is not on discussion later tonight. Okay, seeing none, close the open forum. This time turned over to the city manager to speak to Ordinance 20-10.
Thank you, Mayor, City Council members. The work session was set at the request of City Council to examine current conditions and determine if the parameters at the existing ordinance needed adjusted. Specifically, the occupancy of 50% was of interest by City Council. The regular meeting was set so City Council can make the determination if a renewal of the existing ordinance is warranted shortly after this work session. The current ordinance is set to expire November 7th, and City Council will need to adopt or extend the ordinance should they desire. Jake, can you hit the slide? 3, and this kind of outlines the process. Once again, we're in the work session October 20th. First meeting will be heard tonight right after this meeting. October 27th, we'll have the second hearing, and of course, as I noted, the ordinance does expire November 7th. You want to go to the next one? Thank you, Jake. The city is currently in phase 3 and is considered moderate. The recommendation transitioning between phases is guided by the city's threshold report. The report does look at the percentage of positives over the last 14 days, hospitalizations, and of course testing within the community. Based on council's direction tonight, a second hearing and renewal of the existing ordinance would occur October 27th, as noted earlier, or any suggested changes and amendments that council might desire tonight as well. Jake, you want to go to the next slide? Thank you. Phase 3, which is up here before you, for renewal would be a new ordinance number 20-028. Just for clarification, we always have to renew these ordinance numbers as they come forward. This is phase 3, which is considered moderate. This is also considered the Brookings reopening phase that we've noted earlier. It does require bars, restaurants, groceries, casinos, and gyms to operate at 50% capacity. Employees in restaurants, bars, and grocery stores are required to wear masks. And this ordinance does contain the mask mandate for all indoor businesses and indoor public spaces when social distancing cannot be achieved. There are exclusions for the mask mandate. Tonight, at the request of council members, a number of local professionals will present existing and projected conditions here within Brookings. Tonight on the phone and in the audience, we have Bonnie Specker with SDSU EAM program, Jason with Brookings Health, Amy with Sanford, Patrick with Avera, President Dunn with SDSU, and Kirk Willard with Brookings School District. I know I did note the lineup here. I would recommend and request that we have Kirk somewhere earlier in there. Clint Willard, because he does have to leave by 6 o'clock.
Okay, so just whenever you want him. Begin.
With that said, go ahead and turn it over to Bonnie Specker to present some of this materials and then provide any answers to the questions council might have.
Yes, I thought I'd go over tonight just some of the most recent data and then how we do the hospital threshold. These data are actually from October 18th. On that date, we had 1,199 cases. Since then, we've had 32 cases. Today, we had 8. It's included in that 32, which was actually the lowest it's been since the beginning of October, so that's a good sign. We have had 1 additional hospitalization since this presentation was made. But if you go to the next slide, you can see what happens. These are the individual days and the number of cases on each day. So it is still going up slightly, or up a lot actually, but that not 8 cases hasn't really brought it down, because that yellow line is a 7-day running average. The next slide. This slide shows the test positivity based on the number of people that have been tested. And as of today, the test positivity is around 28%, so it has gone down just a little bit from when this slide was done. The WHO, the World Health Organization, recommends that this test positivity is below 5% before governments reopen. So we're at a very high level. And this is saying quite a few things. One is that there's not enough people being tested, that the outbreak is not under control, and that there's a lot of unidentified cases within the community. The next slide. About once a week or once every 2 weeks, we're able to get Brookings County data. And I should clarify that whenever I say Brookings in any of these slides, it is referring to Brookings County, not the city of Brookings. But every week or two, we are able to get a breakdown of the Brookings data by age. And this slide shows the 4 times we've been able to get that data. And the numbers here in the middle are the change that occurred in the number of cases between October 2nd and October 14th, which was the last time we had the data. But you can see the the younger ages are on the bottom of these vertical graphs, and they go up in age groupings as you go up the vertical. The largest number is in that 20 to 29 year age group. It used to be the biggest percent, but it isn't. I mean, it still is the biggest percent, but you can see where the increases this last time were really in the 60 and older age groups, but where we had 100% increase within that 12-day period among the 60 to 69-year-olds, 106% increase in the 70 to 79-year-olds, and a 236% increase in the 80 plus. In terms of absolute numbers, the biggest numbers were still in that 20 to 29 year age group, where there were 66 new cases and 29 new cases in the 10 to 19 year age group. And this becomes important when we try to estimate the hospitalizations in the next couple of weeks. Next slide. All of these graphs are included in the daily data reports that the city puts up on their Facebook page. And this one I have recently added. It is the number of new hospitalizations by day. We did not have one yesterday, but we did have one today. So there have been a total of 31 individuals ever hospitalized. The Department of Health was including on its website for about a week or two the number that were currently hospitalized. That number disappeared today, so I'm not sure if they're going to be putting it back up on the dashboard or not. Next slide. So when trying to think of ways of monitoring what's happening in Brookings, we decided on using the World Health Organization criteria, and these are the criteria that they use to adjust public health and social measures. And there are three of them: epidemiology, which is when we give the reproductive number; the health system capacity, which I'd like to go over a little bit because that is the one parameter that doesn't seem to ever hit that trigger. And then public health surveillance, so that has to do with the level of testing for suppression of the virus and also for mitigation. Brookings, we make use of one indicator in each of these criteria for the threshold. Next slide. One of the 7 criteria for the health system capacity is whether or not the health system can absorb or expand to cope with at least a 20% increase in estimated COVID caseload. And we used, just to backtrack a little bit, we used that WHO document and tried to find things within each of these criteria that were available on the Department of Health dashboard. And this was the one that we could really try to get a handle on for looking at health system capacity. And it's essentially whether or not the health system can handle a surge in COVID cases, and that would include staffing, equipment, and beds. Next slide. And there were a couple ways of doing this. We have been using the total number of cases in the previous 7 days to try to estimate how many hospitalizations were going to be in the future in the next couple of weeks, knowing or having a good idea of how long that will be before someone's diagnosed and when they could be hospitalized. As you can see here, in the last couple of weeks, the number of cases has increased sharply. And the committee met last week, and we decided that we should also probably be looking at the number of active cases and not just the number of cases in the previous 7 days, since those active cases can still be hospitalized. And since you're active for at least 10 days, the number of active cases may actually be larger than the total number of cases in the previous 7 days. So we use both of those numbers. Next slide. And then we try to come up with an estimate on the number of hospitalizations. And we do that 2 ways. One of them is to take the number of cases, either the previous week or the number of active cases, and multiply it times the overall state hospitalization rate. And we do have that. That's one of the graphs that's in the daily data report. And the other way of doing it is to actually look at state age-specific hospitalization rates, which is also in that daily data report. As on October 15th, if you take the number of total hospitalizations divided by the number of cases, it comes up that it's a 6.4% of the individuals diagnosed with COVID have been hospitalized. Next slide. So we can use that 6.4% and multiply that by the number of cases in the past 7 days. And on October 16th, that was 202. And we come up with 13 possible hospitalizations. If we multiply that 6.4% times the number of active cases, which was 261, we come up with 17. So based on overall hospitalization rate, depending what number you look at, it's either 13 or 17 additional hospitalizations. Next slide. So here are the hospitalization rates by age. This is for the state of South Dakota. It's telling you 29.5% of the people aged 80 or older who are diagnosed with COVID will be hospitalized. And it drops with age. In the 40 to 49 year age group, we have 4.5% of the people being hospitalized. Go down to the less than 20, it's 1%. So 1 out of 100 in that less than 20 age group have been hospitalized. So we're going to make use of these percentages, and by multiplying it times the age distribution of the most recent cases in Brookings, which is shown on the next slide. So this is the age distribution, or the percent of cases that were that were in Brookings between October 2nd and October 14th. So that's from that previous slide I had shown. And so we're going to look at these ages and the hospitalization rates for this, and then come up with an estimated number of hospitalizations. So the next slide. That's shown here, and I've only shown the 3 high age groups. We have here the 60 to 69 age group. Between October 2nd and October 14th, 10.5% of the cases were in that age group. That's the slide I just showed. And on, what date was that? October 16th, we had 202 cases in the previous 2 weeks. So if you multiply that 202 times the 10.5%, you come up with 21 cases. That's what that B, column B, times 202, come up with 21. For that age group, the hospitalization rate is 11.9%. So we multiply that times the 21 and come up with 2 estimated hospitalizations in that age group. And we do that for all 8 of the age groups and total it up, and we come up with 17 estimated hospitalizations that are based on the age-specific rates. And we do the exact same thing for the number of active cases. Instead of that 202 in the third column, we use 261 and do the same calculation. Next slide. And then we provide this table now on the weekly report to the city, and it is the anticipated admissions based on new cases and active cases, so the two different numbers, one using the overall hospitalization rate and one using that age-adjusted hospitalization rate. And then for those, we add the 20% as recommended by the WHO. And so we have anywhere from 13 to 26 hospitalizations within the next couple of weeks. And we send that over to the health system, and they make a decision based on their current census. Next slide, please. They answer the question, is the health system able to cope with a resurgence, based on these numbers? And this past week, the answer was yes, probably. And that probably, I think Jason will be talking next about that, but it essentially boils down to the availability of healthcare providers and whether or not they are out sick. So, and I think Jason's going to pick it up from here, maybe.
I believe Clint is willing to go next, if that's okay, Mayor.
Dr. Willard, do you want time crunch? So could you introduce yourself in case somebody doesn't know you?
Yes, I certainly can. My name is Clint Willard, Dr. Clint Willard, School Superintendent for Brookings School District. And I do have some prepared comments I would just like to share relative to the school district this evening to inform the council as well as the community what's going on. I think it's admirable, and I appreciate the fact that you're seeking input as you're grappling with these difficult decisions. So, Mr. Mayor, councilors, thank you for the opportunity this evening to appear. You often hear me reflect. It's a great day to be a Bobcat. As your superintendent of schools, I'm proud I can express that sentiment even as we experience a global pandemic. By intentionally, as well as actively seeking the input from our staff and from our community, our district leadership thoughtfully and very intentionally developed a plan we call Bobcat Tracks. This plan was approved unanimously by the School Board of Education back on July 30th of 2020. The plan reinforced and recognized best practices of physical distancing, wearing masks, practicing personal hygiene, using prudent approaches to clean and disinfect our schools, providing, ultimately, a safe and healthy learning environment for our students and our staff. We know that our plan is not only working, but it's providing the results of a safe learning environment for all. Currently, the Brookings School District has 5 actual active COVID-19 cases requiring isolation today, and 10 individuals that are in quarantine as a direct result of having close contact with those confirmed active cases. Despite our state currently seeing some of its highest numbers yet, for a district of over 3,300 students and over 620 staff, we are presenting a positive infection rate of less than 0.1% of our current school population. When we add in our quarantine population, we are below 0.4%. Now, I will guarantee you that no one on our team will be throwing their shoulder out, patting themselves on their back, because we know we've just begun the very first mile of a very long marathon. As many know, the Brookings School District is committed to continuous improvement. And as a result, I've been committed to working with all the facts versus opinions Our district leaders and our staff continue to work tirelessly to maintain and, where possible, exceed the standards and guidelines that we all have referred to over and over again, provided by the CDC as well as the South Dakota Department of Health. Bobcat Tracks calls for the isolation of all positive cases for 10 days and the quarantining of verified close contacts for 14 days. While this approach has not always been popular, these practices have worked and are continuing to work. As your superintendent of schools, I would urge the council to continue to advocate for practices that allow our schools, our student activities, and our district to continue to successfully function using our proven Bobcat Tracks plan model. We're in the fall sports season. You can pick whatever sport you like. Today, when we look at the scoreboard, I cannot be more proud of the numbers our team of students and staff are putting up on the scoreboard. Furthermore, I would suggest that the community collectively strive to keep its businesses going by applying many of the same standards and practices that we have successfully implemented in the district, including masks, appropriate hygiene, following the CDC and the South Dakota Department of Health guidelines for isolating and quarantining, and encouraging everyone to practice the personal responsibility of physical distancing. And on the topic of personal responsibility, I think it's one of the reasons that our plan has been successful, because our dedicated team of professional educators teach that very thing every day in every building. Whether it's a first grader remembering to have a sharp pencil and a paper for math class, a middle schooler remembering their books and homework for an assignment, or a high schooler posting comments online for a class in a timely fashion, the priority of personal responsibility for the greater good is essential for the success in and out of the classroom. In closing, I want to applaud the level of personal responsibility, due diligence, and commitment to keep our Bobcat family safe and healthy. This can only happen through the continued efforts of our students, our parents, our staff, our community leaders, and our community together as a whole. Every day we remain in school, our students win, our staff wins, our community wins, and every day that we execute our plan, it will continue to be a great day to be a Bobcat. I stand ready for any questions the council may have, but thank you again for your time this evening.
Thank you, Dr. Oh, Councilman.
To this, but I was just curious how we're stacking up in relation to some of the other districts in our county.
How we're staffing up?
Stacking up in terms of case counts. Is there a notable difference between maybe Volga or the Dubrook district or those types of other local districts in relation to their COVID cases?
Protocol, Mr. Mayor, do I direct my
Go
direct
ahead and
response
address
to the
her directly.
council member? Councilmember Brink, yes. I don't have that data specifically. When we look at reports, we often see what you saw presented earlier by Bonnie Specker, which is a countywide presentation of data and information, so I cannot speak specifically to other individual school districts.
Thank you.
Any other questions? Willard?
Thank you for accommodating me. Have a great evening.
Good evening. Jason Merkley, President and CEO of Brookings Health System. Thanks for the opportunity to speak tonight. I just want to clarify a few things on capacity, bed management plan, and things of the like, and certainly answer any questions that you may have. Next slide, please. Very public and transparent in our bed management plan for our capacity numbers at Brookings Health System. I think we have this on our website. Actually, I know we have this on our website, and we've published this, I think, at least a couple times, maybe in the paper. So there should be no surprise to all of you, although it is a bit confusing when you look at it, so I want to just take some time to walk through it. So what we are counting here is really just COVID positive inpatients within our facility. And so As of last week, you saw it went up a level to 6 through 10. At that point in time, we had 7 people in the facility that were an inpatient that were COVID positive. As of today, we're back down to 5. And so this really goes through how we handle and where we handle the rooms that we have for within our facility for COVID positive patients. And so when we put this plan together back in March or April of this past spring, we came up with the fact that if we were to go throughout our facility, we would be able to handle 80 patients physically within our facility to try to take care of them. The challenge with that, obviously, is we have the physical space of that. What we don't have is the staff. Because on any given day at our facility, we may have 15 patients as an inpatient at Brookings Health System. And that obviously leads to our staffing matrix and our staffing ratios. And so we don't have tens of dozens of people just waiting in the wings to come work when this happens. And so that's really our challenge as we move forward. Not only keeping those people healthy, obviously, but also having enough staff to be able to respond to the surge that we may see in hospitalizations, as Bonnie mentioned earlier. And that's really why we have the probably behind the yes. Next slide. One other thing before we get to our recommendations is just, I think the Department of Health has put out some recent data program across the state in regards to capacity. Again, that is a little bit different data. It's based upon licensure, and some of the information that they get is we provide to them. And so when they take into account capacity, it's not really obviously capacity from a standpoint of Brookings Health System is a 49-bed licensed facility. You will not find on any given day 49 inpatient beds in our facility. You will find 27. Last week we were at just about capacity on those beds. And so what we would have had to do is start our plan to remove beds in other places or use beds in other places to be able to accommodate more inpatient admissions. What we would like to see, obviously, from a council the ordinance and keep business going in our community and region, as Dr. Willard said. Also follow CDC and South Dakota Department of Health guidelines. Masks help stop the spread, wear and encourage use. Promote excellent hygiene practices, hand washing and keeping sickness at home. Keep events planned, do what we can to manage the venues, the group sizes and the mixing within those venues if we can. Obviously effective distancing everywhere, not just at businesses. Take responsibility for yourself and others, and enjoy the holidays and be smart and safe. Questions for me?
Jason, Bonnie was talking about you had 5 in the hospital now. Are you able, and with that count, have we sent any of them out of town anymore? Are we keeping them, or are the other hospitals full?
So the census and capacity is pretty fluid and fragile. Actually, last week we started meeting twice a day to determine, that's how fragile this is. So inpatients, discharges, admissions happen very quickly. And so we implemented a team to meet twice a day with our providers, as well as have information from Sioux Falls. We have sent people down to Sioux Falls, so they do have, at least as of right now, some capacity. Changes hourly, literally hourly. And so as we will continue to do that and be in close contact with them, we would send the sickest of the sick, if you will, down the road to Sanford or Rivera McKinnon. Obviously, there's specialists that are there, critical care specialists that can help those folks where we don't have those options here. We just don't have the pulmonologists, cardiologists available. And so we want to get those people to the degree that we can down there. Obviously, we're hearing about situations where it's challenging. That's real life. It's not fake news. So we're doing what we can with those folks when we can.
Any other questions? Councilmember Brink?
Maybe to elaborate on that point a little bit, I think you were saying how fluid it is with the state numbers and then our local numbers, but as I track the state site every day, and of course they're showing as of today in Sioux Empire, 41% beds available, and how, what guidance would you give the average person around here in terms of that data? Should we take that with a grain of salt? Should we think it's a baseline, and
I think it's good to think of it as a baseline. I think the program is, it makes sense. It's electronic information being passed through at any one given time. Again, it changes very quickly. I think it's a good baseline. I think the pieces of the puzzle that don't come along with that are how many people are out, how many can you actually staff for, how many do you have in your facility sometimes. So there's lots of other factors that go into that. So I would say, I think it's a good baseline, but I wouldn't, write it down as gospel.
Sure. And two other quick questions, if I may. Of the 31 people that we've had total in Brookings Health System in the hospital, are there any trends in terms that are known to you in terms of numbers of days of stay? What's their average length of stay?
It varies.
Okay.
So there's no, I'd probably say a provider should be answering this,
Sure.
not the CEO. But I think it varies depending on obviously how sick they are, how well they respond to treatments and those sorts of things. I just was on an Avera call last week, and I know that they were saying if somebody gets on a vent, they become like a rock. They're going to be there for a long time. And so that's what's driving some of that lack of ICU availability, is that they are there for a long time. Again, most of what we're seeing is not that acute, and so the less acute tend to stay 3 to 7 day type stuff on average. And so they come in and get out fairly quickly, if you will, but not all the time.
Okay. And then my final question, it was in the threshold report this week that we're simply not doing enough testing in the community to get at this. And I just really wonder, and maybe others will speak to this too, but is there anything that this body can do at all to help with that testing equation?
Yeah, so testing's an interesting, thanks, Leah. The testing is an interesting subject, and I could probably sit up here and talk about it for a long time. But the capacity is there to be able to do the testing. Some of it is a little bit of lack of supplies in some cases. Sometimes it's just overwhelming the system in other cases, and so we see a surge in a spot, and if those are getting sent off to Sioux Falls, and as an example, they get bogged down there, then they have to send them somewhere else. Our main challenge at Brookings Health System is supply chain, and so we're not getting the testing kits allocated to us in a timely manner, and that becomes a bit of a challenge depending on which part of my facility you might be in. But at the same point in time, it is a nationwide issue, and we have the manpower to be able to do the test. It's just the corresponding processing of it.
So is that a situation that's kind of pervasive across the state? Would you say that we're sort of in that state?
Yeah. So again, I've obviously sit down and talk with many other CEOs across the state, and same issues, whether in Watertown, Brookings, Huron. I was just on an email chain. Everybody's out of supply kits. We have 2 kits left available, I think, for us to run out. Allocations aren't coming from Abbott, and so we're all trying to scramble.
Got it.
I would say that's probably the same thing, not only in South Dakota, but across the country.
Okay. Thank you.
You're welcome.
Councilman Collins?
Yeah, Jason, of the 31 people that were in the hospital, can you tell me the recovery rate of those? Do you have any idea? Or
I do not, Joey, have that number. I would say that we still have some in the facility, so obviously there's some still recovering.
Sure.
And I know we've had 1 or 2 pass away, and so, but I don't know that number off the top of my head. I'm sorry.
I just want to maybe throw some numbers at you and see if you think maybe this is right here in Brookings, if it's on course with what we're doing here. And maybe Bonnie can answer this too, but the recovery rates in South Dakota, ages 0 to 19 are 100%, 20 to 29 are 99.96%, 30 to 39 are 99.81%. The numbers are all the same until you hit about 70 plus, and then the recovery rate's 87.93. I wonder if you or maybe Bonnie can answer that question, if that's what we're seeing here. This is in South Dakota.
Yeah, I wouldn't argue those numbers. I think that would be reflective of obviously younger people being healthier, not
Right.
recovering.
Okay,
So I wouldn't argue those if that seems accurate.
okay, all right. Thank you.
Joey, this is Bonnie. And I would just like to say that there is a slide in the daily data report on the case fatality rate. And a recovery rate is simply 1 minus that percent, or 100 minus that number. So the case fatality rate, I'm not sure what numbers you were saying there, but the case fatality rate for, say, 40 to 49-year-olds is 0.36%. The case fatality rate for 60 to 69-year-olds right now, based on the most recent data in South Dakota, is 1.9%. So almost 2% of the people who get it in that 60 to 69-year age group will die or have died. And so you figure 98% recover. I don't know what the numbers were that you said, but you can figure it out on slide 21.
Any other Councilmember Bacon?
Have we improved on the turnaround time from testing? When I was tested in July, it took 8 days. Is it better than that now, I hope?
Yeah, so it really depends on what type of test you get. And so testing right now, if it's being sent off for PCR testing, is usually in that 2 to 3 day turnaround process. Now, again, some people have some on-site point of care testing going on. That's what we have at the hospital. And so anything that has to be sent off would go to Sioux Falls. Going to take 2 to 3 days. Point of care is probably more like 15 to 30 minutes.
I know, because my husband had to stay home until my test results were back. So, he was out of work for that 8 days. So I'm glad to hear that it's improving.
Any other questions? Okay. Councilmember Tilton Burn.
I have a few questions, and Jason, I don't know if for a couple of these you aren't the best person to respond. Feel free to say that, and maybe somebody else can chime in. But when we're talking about capacity, you had mentioned that staffing, is maybe the more important thing, or the more limiting factor in all of this, and not necessarily the physical number of beds or rooms. I'm wondering if we're also limited by the types of services we can provide. And what I mean by that is, like, we talk about some more severe cases, patients may have to be intubated, and that may require a certain specialty. Do we have enough specialty providers that are able to kind of address the types of complications that we see from COVID patients?
That is a really good question. The answer is we don't have here physically some of those critical care providers that they have down in Sioux Falls. So now the unfortunate answer also is that we don't have places to put these individuals. And so if we do run out of space, it would be similar to what you saw way back in March or April in New York, where you just don't have opportunities to be able to send them to different places unless it's just specific to Brookings. And so the more capacity there is maybe over in Minnesota or other places, those things would all play into that, assuming that they would take patients from us. But again, if we're seeing the surge happen in many other states and many other places, and so I don't think right now we're probably all that different than Minnesota or North Dakota or Iowa or any of those places. And so we are trying to manage it on a state level, at the same point in time realizing that we're trying to get people to the right location so they can be cared for. And that's just not us, that's also smaller communities around us, smaller hospitals, those sorts of things, who might be using us to send some patients. And so I think the answer is we do everything we can to try to care for those patients. and provide the level that they need. If we can't, we try to transfer them to a higher level of care, and that's just becoming challenging across our footprint.
So just to clarify on that a little bit, we may have to not only send patients to another facility because we run out of staffing capacity and run out of number of beds, but also because of the types of treatments they may need.
Sure. Yeah. I mean, I would say yes. Staffing is a major issue, but again, staffing's an issue everywhere, and so they're only managing what they can in Sioux Falls, and same with Mitchell, and same with Madison, and same with us in Brookings. And so, I think the two factors that play into that are what type of staff you have and how sick the individual is, and where the best care can happen for that individual, given the fact that there's capacity wherever that person needs to go.
Sure. I've heard numbers previously by some of our doctors and healthcare providers in the community that we not only have patients that are seeking more specialized treatments in the hospital facility or in the clinic, but also doing some at-home treatments. If I understand it correctly, I believe it's like oxygen treatments and things like that, where maybe in order to free up some of that capacity space, we're having those patients treat at home. Do we have an idea of how many patients we currently have in Brookings that are treating that way?
I don't have that number with me. I would say that our program, our home healthcare program, is busting at the seams, doing just that. So previously, I wouldn't say that, all of these individuals would have been hospitalized, but we are certainly doing things in the home to try to keep people out of the hospital and try to free up some of that capacity, both, I know, in Sioux Falls as well as in Brookings. And so I think that's going on. I'm sorry, I don't have the numbers. I do know I see record numbers every month from our home health team.
In terms of capacity, when we talk about those numbers and we kind of look at the number of beds and everything, that includes not only COVID patients, but those patients that would be considered non-COVID patients that are requiring care in the hospital too as well, I would assume, correct?
That is correct. So on our census, when we start to get towards the max end of, let's just say, our beds, that would include both COVID and non-COVID patients that are inpatients in our unit. And do we have a sense of how many, is our number of non-COVID patients pretty standard with this time usually throughout the year? Are we seeing more of those patients, less of those patients? So unfortunately, our census, this is why it's so hard to staff. If somebody's got a better idea how to do this, they can let me know. But our census is a little bit like a roller coaster ride. So on one day, on any given time, we could have, say, 7 individuals, and by the next morning, we might have 15 in the facility. And so kudos to those great nurses up there that are able to adjust their schedule and come in and work and be that fluid in their schedule. But that's kind of how we unfortunately roll a little bit within Brookings. And I think we're probably very similar. I've had experience in other places, very similar to other facilities our size, where you don't see that great fluctuation is really in Sioux Falls. They stay pretty consistent, give or take some, but when you have 250 or whatever is dawn in their doors, you pretty much have a more of a fixed staffing model with a little bit of fluidity in it.
Are we having at this point to turn away any elective types of procedures in the hospital, or are we considering that in the near future?
So at this time, we are not turning anything away as far as elective procedures. It has come up only simply because our physical space that we get to when we meet our surge capacity plan that was previously up there starts to dip down into our same-day surgery area. So we have to utilize those rooms. That may potentially impact at some point in time elective surgeries down the road if we would have, again, a full house upstairs in our second floor. We try to stay away from our obstetrics unit as much as we can and leave them alone until basically the very end if we would need to. And so dipping down into that area with it would be your less acute medical patients that would probably be down there, but would have some impact on our ability to perform surgeries at some point in time, potentially.
Sure. And the last question I have on my list here is, we were talking about the recovery rate, and Jason, if maybe you aren't the best person, again, if Bonnie, if you want to chime in, or if there's someone else who might be able to answer this question. We talk about that recovery rate. Is that simply the number of people that don't die? Because I think we hear a lot of examples of people who are dealing with things that are being termed as like long COVID or other complications that come out of contracting COVID. If you have that long COVID, or if you have long-term implications, are you still considered recovered?
I'll let Bonnie talk about the numbers, because she's the numbers lady. But I think the answer is unknown as of yet, Holly. I think I think where we're at with the ever-changing learning that we're having in regards to COVID-19 and the treatments for it, and what works and what doesn't, and what's long-lasting effects and what isn't, and the overall health and wellness of people that have contracted it and supposedly recovered. I'm not sure we have a clear answer yet. I think that will continue to be played out well into the future, if you ask me. And so what I've always said is, man, if you don't, you just don't want to get it. If you can do anything you can to not get it, don't get it.
Mayor, I have a question.
Councilmember Bacon.
If Holly's done. You know, one of your comments earlier was if you were to reach bed capacity, your staffing would be your issue. And it dawned on me as we were talking about home health, are any of the home health care providers trained so that they could come in and assist you in the hospital if you were short-staffed?
Yeah, so our staffing, we also have a staffing plan, emergency staffing plan, and that really takes about anybody that has RN behind their name and tries to apply them to some degree to the plan. And so, yes, it would also include, clinic nurses that might be free or available. Again, it's all based upon availability, because some of those folks have a full caseload in home health that are taking care of not as sick, but sick individuals. And so as we put together the plan, we try to take those things into consideration and do what we can to make sure that we have enough people to care for those individuals. And these individuals are pretty much one-on-one. They're not. It's not easy to get away from that. One, they're positive, obviously, so you want to limit the exposure of people going in and out. And it takes a lot of staff and resources to care for them.
Councilman Wendell.
Jason, I have just a quick question for you on, you had mentioned that we obviously are transferring some patients that have acute needs that we can't accommodate here. And I know that Bonnie shared a lot of statistics relevant to Brookings County and its impact on our kind of capacity planning. Are we accepting patients from smaller outlying communities outside of Brookings County because we're kind of the hub that they're sending them on to, because they have more acute needs than their smaller clinic or hospital can accommodate, but they don't live in Brookings County?
Yeah. The answer is yes. I mean, we have our free referral areas, and so we want to try to care for our region, right? So Kingsbury's not that far down the road, right? So I feel like the answer is yes. They might not be COVID patients, but they're medical patients that might have pneumonia or whatever else it might be, and that's why the challenge in managing that capacity in the census is there. You just never know when to say, "Oh, hold up, you can't come this direction," and obviously we try to take everybody that we can and care for them. So the answer would probably be yes.
Thank you, Mr. Merkley. Next, we'll hear from Amy Hockett with Sanford Health.
Hi, thank you everyone for letting me join tonight. Jason summed up a lot of what we have been discussing on a weekly basis, the day-to-day, hour-by-hour situation that we go through with our patients. In the clinic setting, I guess some of the things that have been asked to talk about are some of the demographics that we're seeing. This time of year, we would normally see a lot of our SDSU students. That isn't the case right now. I'd say more of the COVID positive patients that we're seeing are probably your age 25 and up into the 80-year-old age group. We're seeing, when you talk about the different conditions, some of those folks have some pneumonia, ongoing shortness of breath, blood clots, and persistent fatigue. We do send our patients that need a higher level of care over to the Brookings Health System emergency room, and then from there they to Sioux Falls if that's what's needed. We do also have the home monitoring program that you talked about earlier. We're not really seeing anything. Someone had asked about is it a particular place of employment or a region in town? We're really not. I'd say over the last 2 weeks, it's picked up a lot, and it's all different types of patients that we're seeing, healthy people with known chronic conditions and lifestyles. So with that being said, I wanted to bring up something that we talked about earlier about the masking. Hearing the complaints about that. The masking in our clinic and our staff has been ongoing since March. We come into contact with these patients that we're testing, and they're coughing, and we're examining day after day after day. And I will tell you, none of our employees have tested positive for COVID. So that, I don't know if that helps anyone that's how important it is. So our recommendation, along with Jason and Dr. Willard, would be to at least keep what we have in place, and the masking, social distancing. As Halloween comes up, maybe think about alternatives. We're in a pandemic. Limit the gatherings to 10 people, and that social distance in between. But really, the hand washing, those basic things, if nothing else, to protect us as the healthcare workers. And like he had talked about, our local nurses up at the Brookings Health System that are coming in on call, that's who you're protecting as well with continuing to mask and watch, both social distancing. And we really want to see, we don't want to see the town shut down. I don't think anyone does, but we really want to see our college students come back in January. And when Jason mentioned the day-to-day, hour by hour, he's right. We could come in here in our clinic setting. It's a little different in an ambulatory setting, but we all know we get those hospital updates. It can change overnight. And that's what we're seeing right now. So that's what our recommendations are. People are getting sick. We don't want to, I'm not saying everyone's going to be in an intensive care unit, but there's no way to determine who at this point, just because of all the demographics, they're so different. But we would, go along with please extend those ordinances and the masking. And it does work if you want to take our clinic as an example of we're coughed on again and testing people every day. So there was a question earlier too about the testing. Our clinic does do the asymptomatic contact testing. It's a protocol order. So we are able to test more of those patients if that's needed. So if you have any questions for me, let me know. But we want to see our college kids come back in January and our businesses to thrive.
Any questions? Councilmember Brink?
Kind of more of a comment, and really this would be for anybody, but Amy, I think I heard you say that there's no particular businesses or locations or things like that that you're thinking of when you're thinking of outbreaks or anything in the community. And I don't know if Jason or Bonnie have different thoughts on that, but it doesn't seem like we're aware of any particular places that are hot spots. Is that accurate? Okay.
Yeah, this is Bonnie. I have a couple things to say. Leah, in response to your question, the Department of Health is no longer notifying the public of hot spots like they did with the 9 earlier in the summer, where they realized that a case was in there between certain time on a certain date. They are no longer providing that information, and they haven't been for probably the whole month of October. And that's because they are so overwhelmed with contact tracing that they can't do that component as well. As far as Holly's question on the recovery, recovered by the Department of Health definition is 10, I think it's either 10 or 14 days post either diagnosis or when your symptoms first appeared. So those people with long-term health issues are considered recovered when they're out by that definition on the Department of Health website. And I think Amy might be able to mention some about the long-term effects that they're seeing.
Yep, and I was going to, thank you, Bonnie. That's exactly right. And Jason had visited about that too. We're so early into this. We don't know, but we do see people back in here after 2 weeks that just cannot get better. We're not talking about my 93-year-old dad who currently has COVID. We're talking about, 32-year-old, 25-year-old athlete. They just can't get over the hump. Both things, I think it is. It's too early to tell what does a recovery mean. And so you treat their symptoms and, watch them close. But I think it's too soon to know.
Amy, are you trying to track that data? I mean, I think that would be extremely helpful for all of us to understand, what percentage of recovered patients are ending up coming back in still sick or still suffering from symptoms.
Sure, and that is something that we collectively send our data to Jason, and we've added more of those, the demographics now have been added, and that's how we're able to see, okay, it's this age group from Brookings. But yeah, definitely that would be something we could track.
Thank you.
And again, when we went through the summer here, we all started in March and we did the testing and here and there, but it's for now, I mean, within the last month for sure, the start of October is when we really started to see what this is starting to look like, if that makes any sense. So I think as this rolls along, and hopefully it won't be as bad as we're projecting, we will know more of those answers. But that is certainly something I can track back to your original question.
Thank you.
Councilmember Tilton Burn, did you have a question?
My question was actually answered in all of this. It was going to be about the number of people that we're seeing with some of those long-term effects. So thank you for preemptively answering my question.
Okay, any other questions, Council? Next, we'll have Patrick Sigling with Avera Health.
Good evening, everyone. Hopefully you can hear me. My name is Patrick Sigling. I'm here in Brookings. Thank you for the opportunity to speak with you this evening. I'll keep my comments relatively brief. I would echo everything that Jason and Amy have spoke to. I know locally here, just in the month of October, that we've already had our highest month of positive cases in October, and we're just about 2/3 of the way through. Also closely watching that positivity rate, which if you look back in June, July, we were still maintaining kind of in the single digits. September jumped up to 15. currently October, we're at kind of the 20% mark. So what I would advocate for, what kind of our own internal thinking is, based off the current number of hospitalizations, we're looking at rising number of cases, rising positivity rate, the weather getting colder, which we got a rude awakening of here today with the weather, upcoming flu season. We just know that likely the situation is going to get busier for us. And so we're talking a lot about surge plans, looking at what that's going to look like, making those plans for an increased number of patients within our healthcare system. So we all talk about eventually there will come a day when we can let our guard down. That day will come. I would advocate that today is probably not that day. I get a lot of questions from the community of saying, you know, what should we be doing? What are the recommendations? And it really comes back to the basic, you know, we call it the blocking and tackling things that we've said all along. It's wear a mask, it's socially distance, it's follow proper hand hygiene, and stay home if you're sick. And if you're sick, get tested for sure. So I think for us as a community, anything we can advocate to do, those four relatively simple things will just help us keep our community healthy and keep our community open. So like I said, I'll keep my comments brief, and I'd be happy to answer any questions from the council.
Any questions from? No, I don't see any, so thank you, Patrick.
Thank you.
Okay, next, President Dunn.
Well, good evening, everyone. Thank you, Mr. Mayor and City Council members, for including SDSU in this study session and for your leadership during these challenging times. SDSU is proud to be part of the Brookings community and an engaged partner. And as an engaged partner, as we meet the challenges of COVID-19 together. SDSU is dependent on the community and the largest employer, and as the largest employer in the community and the host of over 11,000 students, we play a large and important role in the economy of the Brookings community. In May, we started a planning process called Jacks Are Back to bring our campus back to life for the fall semester after having to close the campus and send students home last spring. We've worked very hard and are pleased with the results, while we are also very cautious about our optimism that we will be able to finish the semester on campus right before Thanksgiving. While we have managed the virus quite well on campus with manageable levels of cases, we know that of both staff and students, we know that what happens in Brookings will impact the level on campus and vice versa. So I think that relationship is extremely important to always consider. I'd like to turn my time over to Vice President Daniel Scholl for more detailed information, and I'll stand by for questions after his presentation.
Thank you, President Dunn. My name is Daniel Scholl. I'm Vice President for Research and Economic Development at South Dakota State. I'm also SDSU's testing SARS-2 COVID-19 testing lead and an infectious disease epidemiologist by training. Could we have the next slide, please? Part of the context of our decision-making at SDSU is what would happen if conditions deteriorated such that we needed to go back to online testing or online education for part of the semester, or looking ahead to the spring semester, going completely back to online education. What would the impact be on the community of Brookings? That's something that's important to us. And we've recently completed a preliminary study on the economic impact of several aspects of SDSU's operations. But what we want to highlight here is that in 2017 and 2018, measured in 2020 dollar equivalent, student spending added $69.7 million to the Brookings County, so not strictly Brookings City, but Brookings County economy. a little over $27 million of that value was in tenant-occupied housing. The next largest category of spending was at full and limited service restaurants for nearly $6 million. The people who come with the students, visitors, families, friends, etc., added another measured $10 million to the Brookings economy. And the two largest categories were retail, gasoline, and other stores for $700,000, followed by hotels and motels. So the point here that's important to us and we feel is important to the community is that if in-person semester educational services are canceled or shortened, it does have an impact on the community of Brookings. Next slide, please. And student enrollment is a very important thing for us to focus on. This fall, enrollment in the institutions of higher education across the country declined relative to the preceding year. The bar on the far right shows the negative decline nationwide. SDSU's bar showed a less than 1% negative decline. It's on the far left of the graph. And you see throughout the rest of the state, the SDBOR bar, the loss of students was much greater. And in neighboring states of North Dakota, Minnesota, Iowa, Montana, and Wyoming, especially Minnesota, Iowa, and Montana, the potential impact of student loss is very, very real. So we do consider that enrollment is fragile, and that means students at SDSU in Brookings, and we're pretty convinced that the health and safety that SDSU and Brookings offers to our students and their families is an important consideration. Next slide, please. You've seen this graph already presented by Dr. Specker. We really appreciate the role that she has been playing throughout our shared experience in providing data on a daily basis. But what I wanted to highlight with this graph is in the yellow box, the yellow rectangle on the far right side. And we see that following a sharp increase in daily new confirmed cases of COVID-19 in Brookings County, the leadership of the City Council led to the ordinance that we have in place now, which, among other things, included mandating usage of masks in specific circumstances. And the response in new daily case counts was almost immediate, a precipitous drop downward, not to a very, very low level, but a lower level. But recently, that's been increasing, and you see that as the yellow line courses upward over the last couple of weeks. And this shows that masks alone are not the only approach to preventing transmission of COVID-19 from an infectious person to susceptible people. And in fact, what we're seeing is, and these are from numbers that Dr. Specker has provided in her threshold reports, we're seeing that on the average, one case leads to 2 new cases. So you can see how this multiplies rapidly. But key actions, key components of preventing the transmission of COVID-19 from an infectious to one or more susceptible people is avoiding contact between those people, maintaining distances, using masks as a valuable and important adjunct, observing hygienic measures, especially hand hygiene, and keeping sickness at home, which you've heard several times already in this study session. Could I have the next slide, please? At SDSU, we track our self-reported cases among students and among faculty and staff. The graph that you see here covers the same period that was in the yellow box on the previous graph. And we see that, as was the case in the community, on campus itself and among the university population proper, there was a sharp increase in cases and then a decrease. And that decrease, while not low enough, certainly markedly lower than it had been, that has remained lower. And part of what feeds into that is we have maintained our practices within the university environment, our practices of requiring masks inside, of institution and following of hygienic measures among our employees and students, and especially in our classroom settings. And it's working for us. We also have our own internal COVID-19 testing with a rapid turnaround, which enables students who have evidence of infection to put themselves into isolation and therefore prevent that one case from becoming 2 or more cases. Could I have the final slide, please? And so, as others have said, we think that we believe strongly that there are policy actions that the City Council can take that will help us to continue on a successful pathway and get through the fall semester and into the spring semester with having our students here and active and contributing to the Brookings economy, but in a safe way. And that includes, and these all follow the recommendations of both the Centers for Disease Control and the South Dakota Department of Health. Maintain our current occupancy standards, don't relax them, but don't close businesses either. Keep businesses going, keep the economy active. Masks have helped us at SDSU, and it helped in Brookings, and we should encourage their continued and thoughtful, effective use. It's always effective, impactful, and I would argue necessary to promote hygienic practices, such as, including but not limited to, hand hygiene, and again, keeping sickness at home. Events that we have should be planned carefully so as to manage people flow, manage group sizes, manage mingling, mixing among groups, which is the way that infected people come into close contact with susceptible people, leading to transmission events. And then effectively distancing everywhere, not just in businesses, but wherever we are, wherever we gather, in our social settings, in our community settings, in our neighborhood settings, in our family settings, and in our business settings as well. And then finally, we have a big event coming up, Halloween. Let's have a safe Halloween. This is my final slide. Both President Dunn and I are willing to stand for questions from the council.
Council, any questions? No, we don't see any questions, so.
Okay. Oh, Mayor Corbett?
Yes.
I just have one question. We've heard that the Board of Regents has decided to stick with the schedule for next semester, allowing for breaks this time versus how we handled it kind of this semester. Do you anticipate any impacts to COVID cases on campus with those breaks being allowed in the next semester?
Well, I'll start, Councilwoman Tilton Burn. Certainly very concerned. We had the campuses have made a proposal to leave the breaks and the holidays in, but not have spring break. And the Board of Regents had heard from many people that students wanted spring break, and they voted to do that. So we're going to have to up our game and do the very best we can as those students come back next March. That seems like a long ways from now. I guess I just would like to tell you how sensitive this is. The State University System of New York is the largest university system in the United States, and one of their campuses was closed last week with just a flash outbreak of over 700 cases, and very disruptive to their campus, but also to the community. It was a campus of about 7,000 students. So we're not out of this for this semester yet, Councilwoman Burns and Tilton Burn, and certainly we've got to get to Thanksgiving and then start planning on how to handle for next semester. But we're not out of this yet.
I would definitely welcome any suggestions from anyone that's providing information here about how we as a community might be able to prepare for kind of some of those post-spring break possible cases that we might see, because I think that the reality of it is that's probably inevitable. Though I hope that I'm proven wrong. I do expect that if spring break is to take place, I would assume some of those students will be traveling, and I think that could lead to some increased cases. So if there's anything that we can do to help our campus prepare, to help the city prepare, to help our health systems prepare as we expect to see that surge, I think that, like you said, it seems like March is a long ways away, but it'll be here before we know it. And whatever preparations we can start to do now for those kinds of things, I think would be in all of our best interest.
Yeah, I'd even say that we'll probably see a surge in January after they come back from the holidays, because you're just bringing thousands of people back to campus from all across the country, and it's going to happen much like the graph showed there in August. It's bound to happen again in January, even before we get to spring break. So you're right. We have to plan, we have to test, we have to offer testing, and we have to have the capacity in our health system to be able to handle it.
Any other comments, President Dunn or Dr. Scholl?
Just very grateful for the opportunity, Mayor Corbett, and look forward to working with all of you. And thank you for your leadership.
Thank you. And the last speaker is Brookings Chamber of Commerce President and CEO Kelsey Doom.
Yes, thank you all. Kelsey Doom, Brookings Area Chamber of Commerce, President and CEO. The Chamber has remained hyper-vigilant about what we say, how we say it, how we present information, simply because we have members that are on both sides of the spectrum of what COVID has become, right? Last week, we received survey results that I would like to share one of the questions results with you tonight, and then ask what other information the Chamber can provide so that you guys can all continue to make informed decisions for us. So when asked the question, if conditions remain the same as they are now with the restrictions in place, how long will you be able to keep your doors open? 11.7% of the respondents told us they would need to close their doors within 3 months, and 14.9% told us they would last less than 6 months. I'll leave it at that. I just want to provide you that data point and ask what other information we can provide you on behalf of the business community.
Councilmember Brink.
Clarifying question. So that's 25% of the businesses that responded to the survey saying that if we leave things exactly as they are now with the 50% occupancies, those businesses would be out of business within 6 months.
That's correct.
Thank you.
Any other questions?
Mayor Corbett.
Yes, Councilmember Tilton Burn.
Just to further clarify on that, would it be the way the question was asked? Is it fair to say that folks are saying that the current circumstances are leading to that? I guess what I'm trying to understand is, do businesses feel that it is our current ordinances causing that, or could it be some of the other non-controllable repercussions of COVID, such as decreased spending due to perhaps employment issues, or folks who choose not to be as active in public, regardless of what the ordinances kind of are? I mean, I think that the current circumstances are more probably than just what our current mandates are. It's the reality of a pandemic situation. So I'm just wondering, in terms of the way that question was asked, is it more about the amount people are spending, or is it a different impact that's causing that crunch for 25% of our businesses?
Thanks for the question. The question was, if conditions remain the same, how long would your business be able to keep their doors open? I would be happy to ask the question in more detail in our additional surveys that we're going to continue to do over the fall season as we kind of expect this surge that Patrick Siegling had mentioned, to get more detail for you, Councilwoman Tilton Burn.
That would be great. I think understanding what what pieces of the conditions are impacting our businesses the most would be helpful, because I imagine it's a lot of all of those things. But maybe if there's any way these businesses can identify which pieces of the current conditions, whether it's ordinances or fewer people coming into shop because people are having issues with paychecks and things of that nature, I think that'd be helpful.
I can also share with you the results from the May survey that were much more in detail. That was sent to you all, that hopefully helped you in your decisions, and I can resend that as well as additional surveys coming up.
Hey, Councilman Niemeyer?
Kelly, could you give us an idea of what facet of the businesses in town are hurting the worst? Which ones are not getting the walk-ins like they normally have? I realize the bars and restaurants, we have them at 50% occupancy, and the barbershops and salons are limited too also, but is there a certain demographic in our businesses that are hurting more than others?
I would say it's been really surprising in the conversations we've had on who's hurting. There are some restaurants that are doing much better right now. There are some retailers that are doing worse. There are some retailers that are doing better. So I don't have that answer for you, but that's another question that I can dig deeper into. Again, that survey back in May was very detailed, and I'll probably just copy that and move forward with getting you guys some updated details.
Because, as a community, if we can, and, some of these businesses that are struggling, if there's a way the community can help them one way or another by ordering by the phone instead, or somehow support them to help them get through this also.
I'm smiling behind my mask because we'll have a really fun announcement for you all, and I'll email you with ways you can help.
All right, thank you.
Any other questions?
One more question. Kelsey, is there any way to identify, or does the chamber track businesses that close or businesses that don't renew memberships during a time like this? And maybe in a future presentation, you could roll that data into maybe some future survey results for us?
Absolutely. Yep.
That'd be great.
Any other
Mayor
questions?
Corbett.
Go ahead.
Sorry, Kelsey, one more question for you. Could you elaborate a little bit on the response rate, how many businesses responded, and if there was a certain type or segment of business that tended to respond more to the survey than others?
We see typically response rates between anywhere from 80 businesses to 200 businesses. This past survey was mostly food and retail responding to it. Again, I can resend it. Sorry, I didn't get it in the packet here to share the entire survey results with you, but I'll get that, the specifics to you.
Thank you.
Any other questions? Okay, thank you.
Thank you.
Anything else, council, you want to hear on this, Councilman Wendell?
I had a quick question for Bonnie if she's still on the line. Better sense of this than Bonnie might. I think one of the questions we get in particular when we see a spike in new confirmed cases in Brookings County, and I think I know the answer to this based on the questions we've asked in the past, but one of the questions we get is, do we have any sense, are we getting any reporting on which communities within Brookings County are seeing some of these increased numbers? So I think we have assumed that that is Brookings City, but obviously we're also hearing of smaller outbreaks or pockets of confirmed cases in some of our outlying communities. As a council, of course, we only can put restrictions in place that might impact behaviors within our city. And I'm just wondering, has the reporting changed, or if there's any way for us to drill down on a city level versus just a county level on new confirmed positive cases?
This is Bonnie, and no, the data are strictly by county, and there's no way to get it narrower than that.
Thank you, Bonnie.
Turned over to the city manager.
City council members, city council requested the recommendation of a public works department be moved to the work session for future discussion. Within the packet, we have noted the number of employees per divisions to show the FTE, if you will, which is called for equivalents. To note how there would be not a change in the total overall, but how things would flow. Additionally, we added resources within the packet to outline the APWA, American Public Works Association, and the International City Managers Association websites and resources, not only to note the job descriptions, best management practices, but also kind of what's been seen throughout the country. And finally, we linked numerous communities in South Dakota and, of course, peer college towns as well, as requested, to show not only the organizational chart by the community, and once again, for those watching at home, one of the things to consider when you're looking at those peer South Dakota or college towns is not only the population, the form of government, the charter, things of that nature really depict how they utilize the Public Works Director position. The information details every community, once again, utilizes it a little different depending on what services they do provide in the population as well. I'm recommending restructuring of many departments into the Public Works Department. Within the recommendation, we would have one director, and the reorganization will combine 3 departments into one department with 3 divisions and multiple functions underneath. This move does reduce the number of departments to 11. Overall, within the transition, the director positions would become managers. This would create a savings. The transition does utilize 2 vacant positions. Therefore, there is no new FTEs or total employees, no additional sales tax or property tax needed, or there's no impact to the general fund as well. Any additional funds needed for the salary of the Public Works Director would be augmented by the Solid Waste Department. The new department would contain the functions of engineering, stormwater, airport, snow removal, mosquito control, streets maintenance, fleet, landfill, and refuse collection. More importantly, the reorganization under the Public Works Department creates a more cohesive structure for the operations and infrastructure investment of the city. The combination of the departments also allows greater collaboration between divisions that can naturally share resources, communication, and planning as well. The reorganization has the potential to add greater efficiencies for our organization. And within the action, I did call out adding the Community Development Department, which has been a department since 2010 and was added through budget, but was never really specifically called out within any one specific ordinance. So therefore, I did add it within this action. And then, of course, I did also outline the way in which we operate with the Chief Financial Officer as well. With that said, I'd be more than happy to answer any questions council might have with this recommendation.
Council, questions or comments?
I have a
Councilmember
question.
Brink?
Correspondences we had that the assistant city manager does not have supervisory powers. Is that based on our charter, or is that just a choice that we make?
That's just a choice that I've made.
Okay. Does our CFO have supervisory powers?
Yes.
What's the distinction between those two?
So the assistant city manager was brought up through a transition. First, it started out as an assistant to the city manager, and then it transitioned to the city manager, or an assistant city manager. And so you take out that to that, it means so much more. The way in which we created the assistant city manager position, it's really to provide oversight heads when I can't always be there. And so if I'm not there, the position of the assistant city manager is able to provide that guidance and then report back to me when they're able to.
In the org chart, when we show the CFO, would finance still be a department within a department head or a manager level there reporting to the CFO? Or is it implied that that's still Eric?
It's implied that that's still Eric. And Eric would be over the finance division, liquor store division, and then Swiftel Center. Now the Swiftel, it's always been part of our org chart, but it really isn't always had in there. I don't know the history of it. We have no employees out there. It is our facility, but we do contract it, and the director does attend most of our leadership team meetings as a department head, or as a, I guess, advocate for the Swiftel Center.
So I'm also interested to understand the difference between the levels of staffing and maybe, some understanding of maybe how pay grades come into that. So if we have Public Works Director, I'm hearing that word director, but in essence, is there any difference between director in that sense and department head in the way that we use that?
No, we pretty much use both words simultaneously, and they mean the same thing.
Okay. So everybody on this org chart here would still be that pay scale, but the ones falling underneath that, so the liquor manager, engineering, streets, and solid wastes would be managers or one level down.
Correct, correct. But within this transition period, I am recommending the engineering and solid waste direction out. Jackie, and don't mean to call out the specific name, but she's put in 30 years of service to this organization. And I greatly appreciate her service. And as Todd as well, he's put in just as many years of service. They're great people, and they'll be an integral part of this success if council approves it.
Any other questions, council? Council?
That's correct. Traditionally, the Parks and Rec does have the golf course underneath it because it's so similar in the maintaining of the greens and the operations as well. Traditionally, across the nation, you'll usually see the golf department or golf course under the Parks Department, regardless of it being an enterprise fund. Now, most cities, it's something that council could consider in the future, is just make it part of the general fund. Most cities will consider it part of the enterprise fund, which means we should operate it as a business. But theoretically, it usually doesn't ever break even. And so therefore, most of the times, council will transition or consider transitioning that to the general fund. It's 6 of one, half dozen of the other. But because of the way in which we operate it, and most cities operate a golf course, it's very similar to maintaining parks, but just at a higher level.
Any other, Councilmember Bacon?
Go and I just missed it. But our engineering, street, and solid waste departments are theoretically getting a demotion.
No, no. With this transition, I'm recommending that the current solid waste director and current city engineers director remain directors, current pay, current position. They would report to the public works director once they transition out of the city, hopefully not for a few years. Then at that point in time, we would transition those jobs, those positions into manager positions, which would be a decrease in pay.
Thank you.
Council, any other? Go ahead, Councilmember.
I have a couple of clarifying questions. Can you, I'm assuming the numbers that are in the parentheses on the of employees, paid full-time employees that fall under each of those departments, is that correct?
Correct.
Kind of piggybacking off of one of the questions that Leah asked earlier, you had stated that the assistant city manager position does not have supervisory power over any other positions, but one of the things we had kind of noted, I think during our last meeting, was the pink outline box around some of those departments. And I think it was indicated that the assistant city manager is offering some services to those departments. Can you elaborate a little bit on what the difference between maybe the supervisory aspect versus what the assistant city manager does for those departments does, like what the difference is there?
Sure. So every department head, for example, duties that we've outlined, a lot of them are based on the city council strategic plan, just to make sure that we're always marching towards that goal. There's also day-to-day duties and large projects that we have going on every day. And so the city manager, I for example, have open office hours. I have about 6 hours a week that I have open office hours. A department head or any employee or anyone could actually come in anytime, visit with me on any topic whatsoever. A lot of times there are high-level things that I'm constantly communicating with staff on via email, phone calls, what have you. But oftentimes it might be difficult to have a meeting with me because I'm also meeting with council members and people of the public and what have you. And so in those times when I can't be there to provide direct guidance, a lot of times the department heads will meet with the assistant city manager. In fact, he has regular monthly meetings with these department heads. And at that point in time, department heads have the opportunity to discuss anything operationally strategic with the assistant city manager. And this is great because the assistant city manager also is an integral part in putting the budget together. He also assists with some of the policy development. And to be honest with you, he's very well rounded with all the operations. And because he's meets with me more regularly, almost daily, he kind of has that mindset of what direction Paul or the city manager would recommend. And so when I can't be there, and the departments do deserve someone there more consistently, he's able to augment that area. Now, he never does give direction. He gives recommendations, and he'll say things like, well, I'd recommend you visit with Paul on this item, or this is how it was done in this department. And at that point in time, the department head could move forward. They can come see me as well. But once again, just providing that opportunity where there might be gaps in our organization, because there are a number of department heads, and if you look at the different org charts that I presented within the packet, there's a number of ways in which you can set up a city to be most optimal. And where we have so many departments, I want to make sure that we always have someone there to provide guidance if I'm not available at any given time.
Councilman Wynn.
Lack of the pink city clerk makes sense to me. Connection directly to the city council, but can you explain to me what the difference is between the CFO position and would be the difference between the public works position where that same connection, because those seem to be kind of the two outlier departments that don't have that connection to the assistant city manager. What makes those particular departments different that they don't maybe have that same connection there?
Yeah, to be honest with you, it's one that we probably should highlight because city manager does meet with the chief financial officer, and then they will end up meeting with the public works. So it will be something that we'll have to highlight. Once again, this is a new org chart, and every time we look at it, there's something that we need to change with it. So great catch, and it's something that we would need to change.
Now, Councilman Wendell.
Kind of look at the proposed job description for what a theoretical public works director would be charged with doing in our city. I look at the bulleted list. I may be struck by the general nature of the language. It really seems like the ideal candidate by the design of this job description is focused on relationship building and leadership and communication and cultural development, and maybe less on engineering and streets and kind of the elements of oversight that a director would have. And I'm wondering what the thinking behind that is should I infer that to find somebody that would have transferable skills in all these areas is difficult? That a structure that would expect a director to have expertise in those areas would be difficult to find? I'm just curious why we're not seeing more language in the ideal candidate description that would be reflective of the areas where.
Great question. I'm glad you asked that. So this is, of course, an advertisement. The ideal job description will be more detailed. And in APWA, they do note that the ideal candidate should have a background in engineering, could have a background in environmental, could have a background in sustainability, could have a background in finance or public management, to be honest with you. Now, when I would look for a candidate in this position, I would recommend, if we do find an individual that's perfect, that's an engineer, I would ask them to, have that mindset of an engineer, but more importantly, take that mindset out because we have an engineering division. And that way we're not neglecting the street department or the solid waste division as well. What we need, or what I would recommend, is a manager or a leader that is able to provide that insight and opportunity for maybe those division heads, or division managers, to provide greater insight and to be able to bring those policies forward, to bring those larger projects forward. And sometimes it's an engineer, sometimes it's someone with an environmental background. But at the end of the day, we have those resources internally. Todd in solid waste does a phenomenal job with recycling. Jackie does a great job with engineering. Street department guys, they're well managed. And so this individual would be able to take all those resources. And what I wouldn't like to see is someone who just mainly focused on engineering and neglect solid waste or streets. And so they could have a background in engineering. They could be an engineer, but most importantly, they would need to be a manager and a good leader in order to move some of these things forward. There's a lot of things on that strategic plan within the city that the city council has. And there's a lot of heavy lifting that needs to be done within these departments because there's a lot of policy and things that impact this community, from streets to stormwater to engineering and solid waste and environmental. And so the ideal candidate could have a background in engineering, but more importantly, they should be a good manager and leader.
Can I build off of that? Idea of hard skills versus soft skills and what's more of a driver for this. It seems like the diversity of skills that might be helpful for a role like this could be hard to find in one individual. And just speculating here, but it seems as though the salary it might take to lure someone maybe from the private sector into a position like this in a smaller community like Brookings may be a bit of a challenge. I don't know that, but I'm basing that off of some time I spent looking at the ICMA website and doing a search for public works directors, and for cities under 50,000 people, which Brookings is, there are only 2 positions listed nationwide on that website, and of course there are many more in the larger cities. And so that made me wonder, what is it about the Brookings structure that would specifically benefit from that role? I know that Mitchell, South Dakota, went through this over the last several years, putting a public works director in place, and I believe they're happy with the situation now, but it was maybe a rockier road getting there. And they have a different structure in the sense that they also needed this person to manage their public utilities. And so that was a huge part of the job, and we don't have that need. And so I just wonder what your thoughts are on those aspects.
Yeah, so I talked to the Bozeman city manager about that. In Bozeman, Montana, pure college town, I asked them about their structure with the public works director, and they said, Paul, I would highly recommend the separation of wet utilities and dry utilities. And by that, you usually have water, wastewater, which is considered a wet utility. Your dry utilities is solid waste, and of course the services you provide. As far as the ideal candidate, it is difficult to find someone, and I don't think Brookings, South Dakota should ever settle. And if you move forward with this, I would recommend we keep it open until we find that ideal candidate. Now, that ideal candidate could be a city engineer. I've worked in towns where my former public works director, she was a board member for APWA, and there are many professionals out there that are interested in these positions. First and foremost, I would reach out to her to see if she could help us provide guidance and understanding. But I've also been in communities where former city managers were public works directors, and that's because of the leadership, the knowledge base, the diversification that they often hold. And so, once again, if you look at APWA, it will call out not only finance, public administration, engineering, environmental. It could be a person that fits any one of those molds. Does that answer your question, Councilmember?
Byrne?
Piggybacking off of the last couple of questions, I think, Paul, you had mentioned that part of the reason we maybe wouldn't need to list some of the specific skill sets is because we are fortunate enough to have the expertise in some of our departments already, and folks like Jackie and Todd. But I'm wondering if by relying on their expertise and at the same time moving those positions from department heads to manager level positions, if we wouldn't in the future, when they do eventually, hopefully many years down the line, decide to transition, if we wouldn't really be limiting ourselves in the candidate pool for who would apply for a manager position versus that department head position. And I wonder if we wouldn't find ourselves in a bit of a crunch where we might not be able to bring expertise after the folks that are currently filling those roles, because it wouldn't be a department head, it would be a manager.
Yeah, great question. I think what's key here is ensuring that we're grooming those people that are currently below those department heads, 1, 2 levels below them. Right now, we have an assistant city engineer who has their engineering degree and their certification. We also have a stormwater technician that has a degree in engineering and is working towards getting certified as well. And it's imperative that we groom those new people and those people within our organization to potentially step up and take that role, because it's always great to have people locally and internally take those jobs. But once again, you try to find the best candidate. But we try to position our internal into those positions to take on those roles when they do become open.
Any other questions, council?
Position, but I think one of the things that it seems is kind of proposed in the new org chart and in the way the ordinance is worded, but hasn't maybe been highlighted quite as much as these other positions that fall under the public works, is that of the liquor store. So if this ordinance were to pass, we would not only be changing the pieces around the Public Works Department and the Community Development Department, but we would also be making the decision to move the liquor store from a department head to a manager position as well, correct?
Yes and no. That position currently is a manager, and so it's not a director position. And Jake, maybe you can clarify that if I'm incorrect there. And I'm not sure we have our HR people here as well. But that position is a manager and it's not a director, but we define it as a department. And so there is some confusion there.
The posted role is for a manager, though?
Mhm.
Okay.
Well, not only the posted role, but the prior role was a manager as well.
Yeah, I would stated in the current org chart and the one we had previously does show up as it does appear to be a department head, but actually since my time here, it has always been known as the liquor store manager, and it's at a commensurate salary to a manager position.
Within our org chart, not only tell, and so once again, just trying to be transparent in the way in which we operate.
Councilman Collins?
Did you happen to say, Paul, what the salary might be?
The salary for the Public Works Director, and I apologize, Councilmember Brink asked for this as well, and I just got it right before I came up here. So I haven't had time to really dive into it. What I would tell you is it's on par with the current City Engineer Department Director position. It's exactly that same level. And so I can give you those details next week once I confirm all the salaries.
Okay, we're going to close the study session now. Council, do you need a recess before we go into the regular meeting?
3 minutes? Yes, please.
Oh, okay. We'll take a 10-minute recess. Okay, we're at the regular city council meeting. Call on the city manager. Do you want to speak after?
At the beginning of the meeting, there were some comments made. First of all, the individual did note that I was unpatriotic, and I want to tell everyone and make it public that I love this country. What's great about this country is everyone has the right to give their opinion and to be heard. And that's part of the democratic process. One of the things this individual noted was how I supported inclusivity. And the issue at hand was our signs that we have that's done by our Human Rights Commission. The no matter where you are from, we're glad you are a neighbor. Very proud of that sign. It's written in Spanish and in Arabic. And it shows people in our community and people coming to our community how inclusive we are. In fact, it's part of the vision of City Council. We're an open, welcoming, inclusive community. And I live by that because I am the city manager and a servant of the City Council. Anyone who's interested in knowing more about those signs, about our efforts, encourage them to look at our website, stop by my office, and we have more signs available. But that is an effort of this city and something that we'll continue to pursue as long as it's a directive of the City Council. So I just wanted to clarify that. Thank you.
Okay, thank you. Okay, have city manager introduce us in a minute. Just remember, everybody, there is no vote taken on the first reading. It's an opportunity for people to speak to it. And many of you, I recognize, have addressed the council before, and we appreciate your comments. But your public comments are also an opportunity for us to hear from everybody else. And it's very, very important. So if you do come up, please state your name and address. That's important that we have it correct in the minutes. And then also, don't engage other people. You know, you're speaking to the council, so we can hear from you. And in the past, I know we've had some engagement, but let's be respectful for others. And everybody has a right to be heard, and we want to make sure that everybody is heard. Because you can see the time it's getting to be, but also there are a lot of people, I'm guessing, want to speak. So if you can be concise, and please don't duplicate any comments, and you'll have a chance to speak once. So, all right, at this time, City Manager, introduce number 7A.
Thank you, Mayor. That's before us tonight is set to expire November 6th. The regulation requires a 50% occupancy at all restaurants, bars, groceries, and casinos and gyms. Employees at restaurants, bars, and grocery stores and salons and barbers are required to wear face coverings. Face coverings are required when social distancing cannot be achieved, and face coverings are needed for all indoor businesses and indoor public places. There are a number of exceptions noted within the ordinance for medical conditions, people under the age of 5, and there are further requirements and regulations noted within the ordinance. This is the first reading for an ordinance extension, and it is under a different number. Once again, we have to utilize different numbers every time we move forward with an ordinance. So this does contain the reopening language as well as the face passed earlier in September as well. Should the council desire to extend to a second reading, that would occur October 27th or next Tuesday. With that, I'd be more than happy to answer any questions council might have.
Thank you, Mayor and Council. J.L. Thorpe, Brookings County resident. So I guess I just wanted to back up here a little bit. So, I mean, are we not going to discuss the ordinance that was just thrown out yesterday, published, and then disappeared from this agenda? I mean, I guess I'm just trying to follow here how you guys can, 10 days ago, congratulate yourselves for how effective the mask mandate was, how well that was working, cases were going down, and then 10 days later, throw out this ordinance that completely shuts businesses down again until Christmas. I mean, I think people are just trying to catch up here and understand what is going on. A lot of people spoke to many of you yesterday. All of you had a completely different explanation as to the now ghosted ordinance. I mean, I guess I feel that we deserve an explanation for that, so I would like to hear that directly. And furthermore, if that sort of ordinance is going to be published and so therefore is clearly being considered, we need to hear from you under what circumstances would you support a business lockdown? What data and metrics are you using that support locking down a local salon or restaurant, but allowing Walmart and Hy-Vee to continue business as normal? I mean, what is the data that is proving that that would be in any way effective? And secondly, I'd like to hear from the mayor, who I know participates with the creation of the agenda with city staff. What was the process yesterday of throwing everyone in the community into a complete fit and then now just not talking about it?
Okay, we'll get to that.
I actually think it would be appropriate directly, because what typically happens in these meetings is people ask questions and they are not answered, and the council reads speeches that have been written before the meeting. So I do believe it would be appropriate for this question to be answered.
You want to speak to that one?
I don't think that this should be directed to staff.
Okay. Who is?
Although, question, but I would just remind folks that we do have a structure in our meeting, so I don't think it's healthy for us to have a back and forth where you pose a question and we respond. I think we tried that a couple weeks ago and it didn't go well. So I'll answer this question because I do think it is helpful to give some insight. When Ordinance 20-029 was published as a first reading, or that the council would consider a first reading on such an ordinance, I understand that the language and the fact that there was a date attached to such action did cause a lot of concern. What I will say is that it did align with the public conversation we've been having since early summer, where we introduced the phased approach. There were 4 phases that aligned with the direction we had received from the CDC, the South Dakota Department of Health, and lots of other folks who had said there are certain thresholds in place. When you cross these thresholds, you should move into the next phase. We've been living in the moderate phase 3 for a number of months now. Face coverings, social distancing, 50% capacity that promotes social distancing in bars and restaurants. We've been living in that phase for a long time. We've been receiving frequent updates from staff. We've been publishing those updates to say we've triggered at least 2 of 3 thresholds now that would indicate we should move on to phase 2. I think as council, we have known in recent weeks that while we may be hitting those thresholds, I'm not a prognosticator, but I would say some of them we hit faster than I hoped we would. Some of them we didn't get to as quickly as we might have thought we would in late summer. It's not as though we've not been having that conversation, but I do understand that the language around the first reading was concerning. And I think as counselors, we started to have conversations. I know I initiated a number of one-on-one conversations with members of the council to say, I think this first reading language is aggressive. I don't think as a council we actually have an appetite to consider moving into phase 2 right now, nor do I think that we would consider and approve a first reading that would set the stage for a second reading. So if we're not actually taking it under consideration, even though we've hit 3 of those thresholds now that would indicate we should move on to phase 2, then what would be the value of doing a first reading, right? Well, often the value of doing a first reading is having conversation in a public, transparent way. Tonight, we'd already scheduled a study session where we would hear from community health providers and partners in the community around what they were seeing on the ground and the way COVID-19 was impacting our community. So it felt like that box would be checked during our study session in a public conversation around the current impact of COVID-19 in Brookings County and in the city of Brookings. I also knew we had a first reading on deck for Ordinance 20-028, which included the language that we've already adopted. And so it'd be an opportunity to revisit existing ordinances and existing measures that are in place, and again, have a public conversation around the work we're doing right now. So that box seemed checked. So then I went back to the council and said, I think this has created anxiety in the community. I think it's not reflective of the appetite of the council right now. I think it puts the council, the business community, and staff in a difficult position. I would be supportive of just pulling it off the agenda. even though we have hit the thresholds that would indicate we should be considering a move to phase 2, which we have publicly stated since early summer, I just don't think we're there right now. I had shared publicly on my own council Facebook page that I do feel like we're in for a long couple of weeks and months, and whatever action we take now needs to be sustainable. I don't think a move to phase 2 is sustainable for this community. I don't think it reflects the appetite of this council. I also don't think that it aligns well with the work we've all been doing together the last couple of weeks and months. And so I guess I'll raise my hand and say I reached out to staff this morning and the mayor and said, should we pull this back? Because I just don't think it's going to be useful, and I think it's going to create a whole lot more dissension and negativity than any of us are intending to do, and I don't think it's good for a community that is in a rough spot right now, like so many communities across the country. That's really why 20-029 in the first reading of that ordinance was removed. And that gives you some background, but it also maybe gives you some sense of how we got it onto the agenda. I think the process we went through as counselors to determine whether or not it was a useful conversation to have tonight.
Thank you, Nick, for explaining. And I think I mentioned that because that is a question that has come up a lot over the last 24 hours where people are saying, well, how do these agendas get made? And people ask me, just having been in these seats before. And so in my understanding that I was wanting to explain how that happened. So thank you, Nick, for answering that. I think the other question is in 028, section 10, states that pursuant to this ordinance, the city council may by resolution modify the mandatory closures and enact revised restrictions of public gatherings, public movements it deems necessary. So I guess that's the other question here is what's being discussed here is the intent to continue the mask mandate, but I guess I would just like a little clarification on what the council, staff, whatever, feels that means. Because what I read that to mean is that at any time, the city council may choose to very quickly enact closures, et cetera. And so if you guys could please speak to that, that'd be great.
I can certainly speak to that. That language is usually consistent with a lot of our ordinances here lately. And what it allows council to do, if council makes the determination that we need to have immediate action, they can adjust these ordinances by resolution, just as you noted. City attorney could probably speak further on this. He does recommend, even though you approve it through resolution, that you do have a first and second hearing so that the emergency aspect is continued for 60 days. And Steve, maybe you can talk further about that.
Right. If we consider public hearing before we would take any action, and so the resolution procedure would just be reserved for kind of the most serious or emergency circumstances where waiting 2 weeks or more than a week basically before we put some action in place, the resolution would allow us to act more quickly if we deemed it necessary. But again, Paul is correct that our goal here is to have a comprehensive ordinance that addresses all of the requirements unless we're faced with a real emergency where we don't have time to adopt an ordinance.
Thank you.
Anyone else?
Brookings. I'm here again to speak on Ordinance 20028 to renew the 2010 ordinance. As I mentioned here on 9/22, I believe the ordinance should be adjusted to allow for 100% business capacity since we have a mask mandate. Council members said that they were going to discuss the matter. I came back to the last meeting and asked them if any discussions took place, and was told there was none. So for 3 weeks, you guys didn't do anything. And basically, during that 3 weeks, active cases dropped by a net of 18. On October 9th, Councilmember Wendell sent out a tweet, which I quote, "On September 7th, Brookings County had the highest infection rate among the 10 most populated counties in South Dakota. On September 8th, we passed a citywide mask mandate. Today, which is October 9th, our infection rate is the lowest among those counties. Masks work." So again, I ask, why aren't businesses being allowed to open to 100% capacity if masks work? I believe the sudden increase in our numbers is due to one of two things. Sanford has admitted to their lab providing false positive test results for 3 days, October 11th, 12th, and 13th. I have also been told about people waiting in line to get tested, getting tired of waiting and leaving without being tested, and then receiving letters saying that they tested positive. Also, there has been a sharp decline in diagnosed flu cases. It seems everything is COVID now, and the flu no longer exists. We also know that hospitals receive more financial gain for reporting COVID than the regular flu. This would explain the huge jump in numbers since the flu season started October 1st. Our numbers weren't even this high when the SDSU students came back. And when was the last time you heard of someone dying of natural causes? How long has it been since the last death occurred here in Brookings County? I believe it was 3 months ago. As far as the mask mandate goes, I took part in the Back the Blue rally Saturday. I noticed that the city manager posted a video about it stating that even though it was an outdoor event, it was a city-permitted event which required masks if social distancing couldn't be obtained. After we arrived at the police station for the awards ceremony, I noticed 2 counselors, Mr. Niemeyer and Ms. Bacon, standing together talking without masks, and they were shoulder to shoulder, basically, closer than the 6 feet apart. How do you expect citizens of the community to comply with the mandate if the counselors who voted to approve it against the majority of the citizens' wishes don't comply? I think the council should remember that you were elected to serve the people of the community and respect their views and wishes, not push your own beliefs and personal agenda. One last item I have is I believe that you are reporting false information on your daily or your weekly COVID reports. Sorry. Ms. Spector made a comment about total flu deaths in South Dakota approaching the total of the flu deaths for the last 10 years. So, according to the DOH Health and Data Statistics, mortality data, currently there are 330 deaths from COVID in South Dakota. In 2018, there were 246 deaths from the influenza and flu, and in 2017, there were 217 deaths, according to the DOH website. So, and there's some other things on there that I could go into about pushing the negative narrative. The first slide that you showed here today said the confirmed positive cases always going up. Well, they're always going to go up. They're never going to go down. They're either going to flatline or they're going to go up. So I suggest that you should put the negative tests up there, which they will never go down. They will either go up or be flat. You're pushing the negative narrative too much. Also, I question the test positivity rate. I believe your website said it was down to, on your COVID threshold sheet, said it was down to 26%. I looked at the Brookings, or the Department of Health site, and it said our test for Brookings County, positive test, was in the 16% range. Now today, for an example, the Brookings Register posted that there was 8 new positive cases and 161 negative tests. So if you do the math on that, if you take 170 cases and you split that in half, that's 85 cases. So, I mean, we'll do it at 180 to make it even numbers. So you split that in half, that's 90 cases. Well, as a matter of fact, let's just do 10% of 180 is 18. Okay, so if there was only 6 positive tests and there was 180 and 10% of 180 is 18, there is far less than the 26% positive tests that you claim to be as you're exceeding the COVID threshold. Now, this is just for one day. I know it's not every day. The previous day, I believe there was 24 negative or positive tests and 25 negative tests. But as I have commented on that, on their post before, it seems that the positive tests, or the negative tests are drastically outweighing the amount of positive tests. So I would just say, as far as the hospital admissions, the total really doesn't matter because, again, that is always going to go up and up and up and up. What matters is the current hospitalizations concerned with the overload. And you're putting on here your expectations or your, I don't know what to call it, you're guessing. You're speculating on how many of these cases. So if she's saying that if there's 261 cases, she's guessing how many of those are going to go in the hospital. Well, there's only 4 in the hospital right now. And she's guessing it's going to go up to 17 or 20 or 13 or 20 or 17 like she said. You have no way of knowing that. You can't make judgments on speculation. Thank you.
Thank you. Anyone else care to speak? Okay.
Evening. I'm Verna Longville. I sent all of you an email yesterday, and you know my thoughts. But after listening to your study, that is a point. And what we have is we were 6 to 10 COVID positives in our hospital, and it dropped to 5. And when we did the study here, Bonnie posted that her calculation is based on estimates. We would be at 17. And I believe she mentioned that would be in 2 weeks. So go back 2 weeks from today, find out what those numbers were. Don't keep estimating. All of us we're bad publicity for Brookings. We've had enough of that. We made the Argus Leader, we made Dakota News, and we made Kelloland. Get our, whatever, you know what I want to say, in a group here. Do not surprise people with what we did yesterday. We want to keep this community together and quit destroying it. Start working together and not play politics, because that's what I believe we're doing. Everybody will work together and come up with a solution instead of trying to dictate to everybody what we want. Let's do what's best for this community, not just SDSU. There's people in this community that want this community to thrive. And I'll send you the message, what your vision was to be on this council. Thanks.
Okay, thank you. Anyone else?
Hi there, my name is Elizabeth Waika, and my address is 3000 Main Avenue South here in Brookings. So just as a point of like basic utility and function with regard to What does turn it down
You
mean?
can tilt the mic, top of the mic, just tilt it.
There you go.
Okay. Yes, thank you. So just as a function, I'd like to know when an ordinance is developed and published, what has to happen behind the scenes for that to be put up? And I am going to refer specifically to the proposed ordinance 20-029. What has to happen behind the scenes in order for that to be published in the first place? Is it a and that goes for any ordinances, because obviously that's a behind the scenes thing. That's a function of your capacity. What has to happen in order for an ordinance to be published, as this one was? So is it a majority of you, council members? I mean, do you guys all have to agree? you know, I didn't receive any answers. I didn't actually ask for a reason as to why that ordinance was pulled, but based on what JL said, it sounds like there were completely different answers given from various council members as to why it was pulled. I would like to know what happens before any ordinance is published ever, and this one in particular, given the level of anxiety that it created in our community. So what has to happen? And we would appreciate knowing as citizens what it takes and what is required of you in your capacity as city council members to publish an ordinance. And if it's not a majority, why would it not be a majority when it takes a majority to pass an ordinance? So why would it not be one to publish it? So, I mean, if I were any of you council members or the mayor, and this was published and then it was pulled, and my voice had not been heard, that I was not comfortable having that ordinance be published, I would be very upset. Because that means the system is not only not working, and the structure of how the structure of creating an ordinance, publishing it, hearing it, if that structure is not working for you guys, it's not working for us, then we need to look at a different way of doing that. Because, so I would appreciate an answer to that. And if I can't get one in public, I will be emailing each of you individually, because I do want an answer to that. I would like to know how this happens, how these ordinances get, and, you know, and I would appreciate some accountability. I would just appreciate knowing how this happens, for good or for bad. Thank you.
Okay.
I think I can address that. Our approach is to be ready, I guess, in uncertain times. And so as a staff member or providing the services to the city, it appeared that we needed to have a couple of options available to us. And so it does take a fair amount of time and effort to draft that type of ordinance, to bring it up to October 2020 as opposed to where we were in April or March. And so I would take the responsibility of initiating the drafting of that ordinance. And where it doesn't appear to be necessary or timely at this point in time, then I think that it doesn't bother me, because at least we're prepared. It's part of the planning to be ready, because I think, you know, we're getting a lot of circumstances, facts, and so forth that require us to be able to pivot one direction or another. And so that's why staff initiated the drafting of that ordinance, and the explanation Councilmember Wendell provided was why it was pulled from the agenda.
And I would only add to that we here, the city clerk, city attorney, and myself as the city manager, are a team. And so as we combine and create those documents, a lot of times we work back and forth to create that language. And usually it's based on the language that had been used in the past. So as Councilmember Wendell noted before, we had those ordinances created, and so then we work together to update those, and then it gets placed on the agenda. And maybe the city clerk can note who can place items on the agenda. I know the city or the mayor does ask at the end of the meetings items for discussion at the next meeting, or ordinance and things of that nature, but I know I've asked that question before.
Yes, Mayor and Council. The City Council, City Manager, Mayor, under the advice of staff, can add any items to the council. Usually it's placed on an agenda with consent or majority of the council.
Anyone else care to speak?
Corbett,
Yes.
that discussion that the way ordinances and resolutions are drafted is not necessarily one uniform way. Council members can certainly bring language forward, and typically there's collaboration done with staff members, whether that be the city attorney, the clerk, or the city manager, to develop that language. Other times, some of the language may just come forward from city staff members based on guidance that they give in their area of expertise. I've even historically seen instances where members of the public or members of our committees, the city committees, might come forward with language for ordinances. And so the way ordinances are drafted, there isn't just one unique model. There's a lot of different ways that that happens. And then, as it's been explained, there's a lot of ways it can be added to the agenda as well. Council members may request that be added to the agenda. Staff members may add it, considering their areas of expertise. So I don't think there's any one particular way we put these items on the agenda. There's a lot of different ways that this language can be drafted and brought before us.
Yes, Councilman Bacon.
That's why we do this, and especially first readings, because this gives us the opportunity to get public input, for us to openly discuss that issue before we would, make any major decisions. So it's a number of pieces of that process, but it's all to bring it to the public first before we make any final decisions.
Anyone else care to speak?
Good evening. My name is Kyra Worm. I live here in Brookings City proper. I am not a business owner in town. I do not have hundreds of thousands of dollars of disposable income to spend in Brookings. I have no skin in the game as far as how some of these things play out. But as a person of principle, I feel weary of the narrative that I hear when we come to the meetings. When we enter the meetings, I know this is a study session, so we had to spend a lot of time doing our due diligence, looking at numbers and those sorts of things. But what we hear every week is doom and gloom. And we all know that we can take those statistics and we can spin them any way we like. Today, we heard the Brookings Health System leader tell us and compare Brookings to New York City in March and April. To me, that does not seem like a fair comparison. We hear and see graph after graph of where the numbers could go. At the beginning of this conversation, we were really set on, these are the metrics that we're going to use. We originally had 4. I heard Nick tonight refer to 3 of them. I'm not sure. I think it's hospitalizations that we threw out the window. Now we're working off of 3. Okay, and we've sometimes met the threshold for 2. Then we have, it feels like manipulation when we have ordinances like 2029 thrown out there and pulled back. And I know I've heard your explanation of how that happened, and I respect the process. There's a lot of moving parts. There's a lot of things we need to be ready for. I understand that. But we did the same thing in September when we came here and we had 4 big amendments to an ordinance, and everybody was fired up. There was some disrespectfulness happening. Everybody was just riled. And we simply, easily pulled out 2 of those amendments without even any question. And so then everybody settled down and we were able to put in place the 2 amendments that we currently have today. Now everybody is sort of come to terms with the amendments that we have in place. So we throw out an ordinance like 2028. Throw out is the wrong terms. I know it takes a long time to put these things together, but it seems like a lot of politics happening behind the scenes, and I think maybe that's what Liz was trying to get at about what is the process, because we put out 2029 and everybody gets fired up and there's legal pushback and there's tons of emotions behind it, and now we come to the meeting and that's out. Okay, we no longer want to entertain that. We're going to do something much more palatable like we did in September. So now we're looking at 2028. Similar language to before, except that it's changing up until hours before the meeting, because what I pull up currently on my phone and what I printed off in paper at 4 p.m. doesn't even match up 1-to-1. So it's really difficult for the ordinary person to keep up with the changes from these ordinances. In the last couple of hours, the last hour before the meeting, from what I printed,
So what I click on now on my phone is different. Okay, so that doesn't seem like preparedness to me. That seems like we're just scrambling to keep up and not really have cohesive working together on what we're putting forward to people. It feels like a lot of politics. The other thing that 2028 is doing is continuing to keep our police department in a terrible middle position about we're passing ordinances that are so hard to enforce that we don't have the capacity to enforce, and we're just keeping our police officers there in the middle of all that. That seems totally unfair. Also, 2028 retains language that says the council has the immediate ability to add other things in place as deemed necessary in an emergency capacity, like we call these meetings 24 hours in advance and change the ordinances leading up to the meeting. So all of that feels, although it's the same, we're not taking any huge steps in action tonight. It seems like we're teeing up to really take big action, but more behind the scenes. And so we come here and we say we're being transparent and we're taking public comment, but when it comes right down to it, a lot of times, no matter how many people, we had to move to the Swiftel for public comment, right? We sat through hours and hours and hours of public comment, but it doesn't change the decision at all. And so I maybe don't even have a specific question, but I just want to call that to attention, that for the average person in Brookings, with no small business, no economic impact in the game, just a mom teaching, leading, living in Brookings, it seems like we're being manipulated. It seems like there's a lot of politics and that there's a lot of push and pull with these ordinances, and I hate having the police department in the middle of this. I hate feeling manipulated in the way that we have been. And so whether that is a function of the cohesiveness of the council getting together and thoughtfully putting together these ordinances, or whether that is really thinking far in advance politically and seeing what can we get across with the least amount of pushback and the least amount of public resistance, that seems like what's happening. So I just want to call attention to that and express that sentiment that I think a lot of us are feeling.
Yep.
Thank you.
Anyone?
Good evening, Mayor and council members. My name is Teresa Holloman, and I live in Aurora, but I have a business, one left in Brookings. And I actually did participate in the survey that Kelsey mentioned earlier, and I can give you my reason for my answers of possibly not being able to sustain my business much longer. That's because there's a fallout that perhaps hasn't been considered as a result of mandates like this, not just in our community, but in other communities. We've lost a lot of our shoppers and our diners because they don't want to mess with the masks. They don't want, whether they want to wear them or don't want to wear them, some of them they just don't want the contention. So they're taking their business elsewhere. And I'm hearing that from my customers, apologizing to me. You know, I would love to come in, but I'm just avoiding Brookings right now. So they're shopping online. They're going to Sioux Falls. They're going other places. So I just kind of want to bring that to your attention that that is affecting us. And I'd also like to bring to attention that some of us are unable to get the PPP money. And I'm not going to go into details, but I am one of those. So I'm all on my own. And I'm not the only one. I know there are other business owners that are in the same position. And actually I have a couple of friends of mine that they actually already closed their businesses. And they're brokenhearted. I'd like to propose, actually, if I could just say, I've always said if I ran for president of the United States, one of the first executive orders I would pass would be that Congress would not earn more than the median annual income of the American family. That would be their income. So if they wanted to make more money as a congressperson, they need to pass laws and make policy that help all Americans improve that median annual income. I'd like to propose just a little idea out there. If you council members would perhaps be willing to forego some of your pay, because I'm hearing rumblings about increase in taxes. And those of us that are struggling right now, that's not what we want to hear. We are not even getting enough business to pay some of our ongoing expenses as a business owner. I can thank God for one thing. My business that I have does not support me. I have other incomes. I think I've mentioned that before. What I need my business to do is to support itself right now. And that is how bad it has gotten. I don't have any employees. I'm the only one. And I work for free, and I am still struggling to pay my rent, my insurance, my utilities, my vendors. I'm not even going to say the number out loud, but this is a fairly new business for me, so I am heavily invested. And anybody that has come into my store can attest to the fact I have a lot of inventory. I need to sell my inventory. And I don't sell online. I'm a brick and mortar. I'm trying to bring that back. I'm trying to participate in making Brookings a better community and bring people in. And I can tell you, people that come to my store, they love my store. They find unique, special things that they can't find anywhere else. And I don't want to close. I don't want to leave. But I will tell you this, I'm not going to put up with what's going on here for another 6 months to a year. I will pack up my business and I will take it somewhere else. So I just hope you put a long thought and prayer before you take away our rights. Thank you.
Thank you. Anyone else? Close the public comment, council comments, questions? Councilman Wendell?
We continue the conversation. I really, anytime I think we all anticipated as we began to consider this ordinance again and the potential of extending the mask mandate and the 50% capacity, that we would continue to engage with community members. And certainly, I think I'll speak for myself and say certainly over the last 6 to 8 weeks, that has been a pretty constant current, but of course each time an ordinance is on our agenda, it's an uptick. And one of the conversations I've had with lots of community members has been this idea that I think there's this narrative that there are only one of two options we can take, either this extreme, which is that we do a shutdown and a lockdown and it's our only option to keep everyone safe, or on this extreme, we just swing the doors open and we lift all restrictions and let COVID just run its course. And I think as we get used to COVID-19 in our community, we know that there are some middle options. And I think Ordinance 20-028 is representative of that kind of middle of the road approach, where we encourage masks when you're in an indoor environment where 6 feet of social distancing isn't possible. We encourage 50% capacity in bars and restaurants so that we can create an environment where social distancing is possible. We link arms with our school district, which I think has done a commendable job in ensuring that our schools remain open and our students remain safe. We haven't had a single activity canceled because of an outbreak in Brookings. But there's a whole lot of larger school districts across the state that don't have similar mandates in their schools that have had to cancel activities and had to move to remote learning, which we would know the challenge that would bring in our community. The same partnership with our university, which I think has led to good results. And so I think there is this narrative or these arguments around this idea of extremes, that either we shut everything down or we swing the doors open. And I do think this ordinance is reflective of a more middle of the road approach. And the majority of community members that I hear from are pretty satisfied with a middle of the road compromise that is sustainable, not knowing what the next couple of weeks and months may bring.
Okay, thank you. Any other Councilmember Brink?
A couple of things that were said tonight really sort of hit home for me. And I think the comment you made, is it Kyra? We're weary of this. We're extremely weary of this. And I know that applies to all of you, but believe me, it applies to all of us as well. It's not super fun to come and keep debating the same things again and again and again. And for many of us, our core fundamental positions on some of these things haven't changed. So it kind of feels like we just do the same meeting every 4 to 6 weeks. And I don't want that to be forever. That doesn't need to be our new normal. It's also a good reminder, Ms. Wyka, the question that you asked about how does the secret sauce get made? I think that was a good question. That's a fair question, given the events of the last, the day, I guess, and pulling that ordinance off of there. I will say, from my perspective, what shows up on our packets is primarily not driven by council unless it's something that we have specifically asked for, or it's an ongoing project or a matter of normal business that, kind of happens. But I haven't been involved in writing any language for any of these proposed ordinances. So that's, if that helps anyone understand that a little bit. Since this all started, I work from home and I'm kind of a nerd, so I spend time on the South Dakota Department of Health website every day. And I've been looking at their stats every day. And I have my little spreadsheet that I feed data into every day, and I make some charts and graphs and I look at it. And this issue of framing and how we frame everything in the worst possible way and make it sound super negative is a valid point. As human beings, we respond better to positivity and less anxiety. It produces less anxiety in us, which helps us in turn be nicer and kinder to our friends and neighbors and people that we might not agree with. So I definitely think that what we can do to frame positivity is a good thing. And talking about things like, almost no one is going to die of COVID. For people that do, of course, that's a terrible outcome. Nobody wants that. But if you're under 20 and you're in good health, you're probably not going to die. And so I think these are things that we need to keep in mind as well and be balanced. Anyway, State Department of Health website, 21 of our 66 counties in South Dakota as of today have higher case percent positivity rates than Brookings County. So that's 1/3 of the counties in the state are testing higher percent positivity rates than Brookings. So that's how we're stacking up against those other counties. And then I remember when we went to substantial spread here in Brookings, that was a kind of a milestone that bothered people. I think every county but 10 in South Dakota are now classified as substantial spread. It's all dark blue now when you look at it. So to me, that brings up the question, the logical challenge that I've had with these ordinances from the beginning, which is that we are one tiny little oasis in a larger state, and we have no control over any of the actions that any of those other places take or any of the people that are going in and out of those places. So as I think about these things, I want to weigh out what is the potential harm and damage done to the people that live and pay taxes in this community relative to what we might actually reasonably be able to control or influence in any way. And that's where I struggle sometimes, because I don't always see that what we're doing is going to actually have any kind of effect. And I've spoken at many meetings about how I'm uncomfortable with mandating these things, which I believe ought to be better as guidelines. So that's, you've seen me to hold that position, and that's probably not one I'm going to change anytime soon. So then that brings us to our thresholds and our metrics. So we had this discussion tonight, and now we're saying things like, first of all, we put these thresholds in place, which, these things, sure, they were adopted, but it wasn't necessarily with everyone's agreement of those. And now what we're saying is, oh, well, that one threshold that we're close to meeting, I guess maybe that one doesn't matter. So it makes it feel silly that we're, we may not be prepared to follow the thresholds that we set up and put into place. And that might be the reality of the situation. And so, again, everyone is doing their best, and I know everybody has good intentions. We just don't have the same ideas about how to get there. So I will just wrap this up by saying I want everyone to keep doing their part, and I do believe that individual actions are going to be the most effective at fighting this thing. And I'm going to continue not voting to make you wear masks, because I don't want to be in the position 6 months from now, 9 months from now, having to vote to mandate you to take a vaccine that you don't want to take. So that's, that's another step that's going to come down the line here at some point. And we know a lot of people aren't going to be comfortable with that either. So just want to give you a sense of where I'm at and what I see. Thank you.
Bonnie, was there anything else we had with Chelsea and
No,
Christine?
there's currently no one.
Okay, thank you. Councilmember Bacon?
Well, I was just going to follow up, excuse me, a history lesson. It was asked, how do we even come up with these ordinances? And if you are attending meetings or watching us very often, you will hear the mayor at the end of every meeting say, are there any topics any of you would like us to bring forward? And so at that time, we bring those suggestions. Historically, then it usually would end up in a study session like tonight, where we would get more informed, detailed information. And then from that, we may decide that we want to propose an ordinance. So that's traditionally how we have worked through that process. Unfortunately, COVID has, forced more urgency sometimes. We haven't had the typical longer time to work through these. We're in a unique time that I know we're all tired of COVID. We all hate COVID. We all feel we need to blame somebody or something. But that's forced us to have to react a little more quickly on these things.
Thank you, Councilman.
I'm looking at the numbers a little bit differently than I think most people are. Maybe some of you are looking at them. But instead of looking at like the death rate, which, God forbid, I don't want anybody to die. Please don't think that I'm looking at it that way. But I'm looking at the recovery rates, like I mentioned earlier. We should be 0 to 19, there's 100% recovery. I mean, I'd like to look at those numbers of all. The numbers don't change too much until we hit 70 plus, and then it goes to 87.93. I think we could look at those numbers more positively than what we are. And if it was up to me, I'd like to stop the regulations altogether and turn them into recommendations or guidelines. This isn't going away. I mean, I think we all know that. It's going to be here for a very long time. And I don't know what our I don't know what our end goal or what we're going to do or what was going to satisfy us to vote to go back to some kind of normalish where we're not wearing the mask and we can go to guidelines. I think if we did stop everything, I think people would still continue to do what they're doing now. Obviously, high-risk people, take care of yourselves. Just devastating news from you folks that came up here tonight talking about businesses, and I'm sure we could go one story after another and hear the same things. I've had my friends call asking me not to vote for anything that has anything to do with more restrictions or anything. They're on their last month or two before they have to say quits. The criteria clearly says that we should move to phase 2 if we follow the criteria. But we're not actually following the criteria because we're not actually going to vote to do that tonight. So that's telling me that maybe we're not following them like we're supposed to. So maybe if we could turn the look the way at the positive numbers, then maybe we could just think about it more or less that way. And if we can't do that, then I would say, is it possible to, if we have to have the mask on, if you want to wear the mask, then let's open up 100% so our businesses can get back to where they need to be. And obviously, I'll vote no to this tonight. I guess we're not voting on this, but reading it? Okay. But in the future, I won't, unless something changes my mind. But
okay.
Thank you.
I just got a few right. I was at that police support the blue thing last Saturday morning. I was not wearing a mask. But I was standing all by myself, and Patty came up there, and I am so used to wearing a mask normally where I'm at, I didn't even think about it. and I apologize for that. That was on me. The other thing was too is JL said something about all of us had pre-written statements at our last meeting when we voted for this ordinance that we may extend. She of all people knows that I usually come to a meeting with a blank piece of paper, and I usually write notes down as I'm going through the day or going through the meeting. The only thing I had was a paragraph basically telling everyone that I read every email I could possibly read, and I didn't have time to respond to any of them. The rest of what I wrote there was side notes of all the people that were coming up to talk to me and the rest of the council. And I slowly selected phrases from almost everyone that came up there. And still that's a good point. And I put it all together. I had some things in my mind what I wanted to say, but the rest of the people that came up to talk to us and explain to us their opinions was part of my what I said. And most of what I tried to say was, as a community, we need to come together and try and figure out how to do this together. I think the mask mandate has helped us get through what could have been somewhat of a disaster. Bradley and Bonnie, neither one of you probably could have estimated what could happen. And what numbers do we ever use? I'm getting tired of looking at numbers. I'm getting tired of this whole thing. But this is the only thing that we've got right now that we can do to keep ourselves well. I don't want to see any of you leave Brookings. I don't want to see anybody get buried 6 foot under. My mom's assisted living got completely infected in Sioux Falls. They lost 5 people in that building. There's 5 families that lost their parents. I didn't lose mine, fortunately. I'm not quite ready to do that yet. But we have a facility in town here that's having the same situation. For now, I don't think we've lost any of them. But I want a sense of community to come back. My pastor asked me, what can our church do to help the community? As a city leader, what do you feel is the best thing that could happen for this community that this church could do for it? And I says, try to bring back some kind of sense of respect for each other, compassion for each other. Think about what we're having to deal with here. None of us wanted this virus. So as a city council, we're trying to figure out how to best help keep the safety of our community at the utmost. And however you want to do it is fine with me, but we have to have, I feel, the city council has a responsibility to set some set of guidelines to go by. And then after that, we have to work with it. Now, small businesses, I want to know what your small businesses are. If there's anything that this community can do, is try to help those businesses make it. I mean, we got to get through this thing. I've had, the pleasure of working out of this community in certain areas. We have to wear masks in most of the public schools we work at. I was in Lower Brule last week. They're devastated. They have no children in their school. All the teachers are trying to teach out of their classroom over the internet. And I asked the 2nd grade teacher there, I said, how's it going? And she said, it's horrible. They don't, I mean, they obviously have figured out technology, but it's pretty hard to keep a 3rd grader and a 2nd grader. I've got a 3rd grade Bible school that I try to do for 30 minutes every Sunday morning. It's pretty tough to keep their attention. So I can just about imagine what it's like for a longer period of time for some of our teachers that have to do this online thing. So for us to be able to have our students go to our school, this is really cool. And for us to have the 10,000 or over 11,000 students in our town spending their money, getting an education, instead of doing it online at home, think about how many businesses would not be going by now if the students hadn't even come back. I don't know what else to say, but we need to find a sense of community again and find a common ground and try to be able to work with each other. I don't know how else to say it.
Thank you. Okay, there'll be a second reading. Oh, Councilmember Tilton Burn.
just wanted to make a couple of comments about the process and in response to some of the comments that we heard tonight. I just want to say that for all of us that serve on the council, we are 7 members of this community, and I want to remind folks of that we truly are members of this community, trying to do what we are figuring out might be best during a really difficult time and during a really hard situation. None of us were trained on how to respond to pandemics, and we don't have a book that tells us all the right answers. We're literally trying to take the data that we receive from local experts, from the state, that we just know about our capacity in the community, and we're trying to make the best decisions based on the information at hand, in addition to hearing the wants and needs of our community. And I understand that some folks are feeling like this process is a bit messy. It's maybe not as straightforward as they would like it to be. And I recognize that is the case, but the fact of the matter is it's not easy working through these things, even on this end as a council member. And there's no playbook that tells us how to respond to a pandemic. And so we're working through it as best we can, while fully attempting as best we can to receive input from the public in this process. And I apologize if that gets messy at times, and if it's maybe not exactly clear how we come to posting some of the ordinances, or if there's distaste for the way that we amend things during meetings. But that is part of the democratic process as we pass these ordinances, and we want everyone who continues to participate and provide their input to continue to do that, because that's just as crucial a part as our role that we play as the council members. I don't think it's not easy for any of our business owners. It's not easy for any of the parents in our community. It's not easy for our community members to work through this. But we are also business owners and employees and parents, and trying to do that as well as best we can. And we rely on that back and forth between the community to make that happen. And so I want to thank all of the experts that come forward and speak with us and provide information to us. I want to thank all the community members that provide their input, because, like I said, we are just 7 individual members of this community trying to do what's right in a really difficult situation. And I don't know that any of us knows what the right answer is. And we just can continue to try and strive for what's best with the information we have at hand.
Okay, thank you. Next Tuesday, October 27th. Council, the next meeting, obviously, is October 27th. We'll have a second reading on Ordinance 20-028, and the Human Rights Commission will present the Butler Award and recognize Dr. Diane Nagy. It's going to be a great night. Anything in the future you can think of right now? Okay, to the media, we'll be going into executive session. There will be no action taken when we come out of that. Broke your heart, didn't I? Tell. All right, so council, at this time, we're going to executive session pursuant to South Dakota Codified Law 1-25-2 for discussing the qualifications, competence, performance, character, or fitness of any public officer or employee or prospective public officer or employee. The term employee does not include any independent contractor, and for consulting with legal counsel or reviewing communications from legal counsel about proposed or pending litigation or contractual matters. Council entertain a motion to go into executive session.
So moved.
Second.
We got a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Executive session.
6 o'clock next